Welcome. On behalf of my fellow Worcester County Commissioners, I would like to thank each of you for joining us virtually today for the 12th Annual Public Health Conference, Building Bridges to Better Health and Wellness. As we kick off the conference, I'd like to thank Worcester County Health Department professionals for hosting this conference. Today's discussion will focus on vaccine hesitancy in communities of color and everyday coping skills to address the effects of loneliness caused by the pandemic. Before we begin, I'd like to thank our dedicated healthcare professionals for their role in addressing the COVID-19 pandemic. Both the health department and their public and private partners have worked tirelessly to educate the community on safety and mitigation of the disease, to test and monitor positive cases, to vaccinate citizens, and to promote public safety and enforcement. Thanks to their Herculean effort, when it comes to vaccinating the public, Worcester County is ranked second in the state for having administered over 13,900 first doses, that's 27% of the population, and over 9,100 second doses, 17.4% of our population, with 0 wasted doses. Worcester County is incredibly fortunate to have this highly committed team of health professionals working to protect public health, particularly in extraordinary circumstances brought on by the pandemic. In closing, thank you for attending the conference and for your interest in learning more about public health and its role in building healthy communities.
Fantastic. Thank you, Summer. And of course, thank you, Commissioner Matresic, for the wonderful opening that we've got there. And then to touch a little bit more on those themes and discuss what we're going to be covering today, I'm going to go ahead and turn over the screen to Worcester County's health officer, our very own Rebecca Jones. Becky, take it away.
Good morning, everyone. I'm Becky Jones, as Travis said, health officer for Worcester County. And I would again like to welcome you to our 12th annual Public Health Conference, Building Bridges to Better Health and Wellness. This conference platform follows the very unique, unprecedented is overused, so I'm not going to use that, year we have all endured. And we are coming to you, as Travis stated, via Zoom. Technology is a blessing and a curse, so we will ask for your patience if there are any unforeseen glitches. Just a few housekeeping topics. I think we're all accustomed to this, but just a gentle reminder. Please remember to keep your microphones on mute if you are not speaking. If you have a question, please enter into the chat box feature as it will be monitored and questions will be shared with the speaker. Travis, did I forget any housekeeping?
No, I think that you covered everything. Yeah, just if people have questions or thoughts, you can put them in the Q&A. If at any point you want to speak, or if you have any thing that needs covered, you can put up your hand. There should be a little raise hand button at the bottom of your Zoom panel. And Zoom really is a lot of fun and exciting. And this is one of the first major events that we've done with it. So let's all hope it goes okay.
Okay.
I'm sure it will.
It will. All right. So as many of you may know, this is National Public Health Week, a time to formally recognize and celebrate the achievements throughout our community. I want to thank you for taking the time today, your attendance, and most importantly, showing your support for public health here in Worcester County. This year has been tremendously stressful for all of us, for our citizens, our families, our children, and of course ourselves. We've experienced shutdowns of critical services, stay-at-home orders, school closures, and numerous changes to our normal daily lives and routines. Besides the shutdowns, we've been asked to keep distance from each other, which may prove to be the biggest challenge we have all endured. We may be physically distanced from each other, but now it is more important than ever to come together. The pandemic forced the cancellation of our conference last year. However, we were determined to connect with you and move forward with providing this virtual conference, again, for a stronger community. I assure you that despite shutdowns and stay-at-home orders, never did the Worcester County Health Department lose sight of our role to promote health, prevent illness, and protect our community. We learned and adjusted very quickly sometimes, to provide critical services, including behavioral health and reproductive health through telehealth modalities. Technology could not and did not replace our frontline presence for COVID response, which included testing, home visits for disease investigations, or isolation and quarantine support, enforcement of the executive orders, or vaccinations. Speaking of vaccines, you may have read that beginning Monday, this Monday, April 12th, the governor has authorized anyone 16 years of age or older to be eligible for a COVID vaccine, should they choose to get one. If you're interested in receiving a vaccination, please remember to visit marylandvax.org, select the second blue button, type in Worcester, and the list of available clinics should show on your screen. We are very fortunate here in Worcester County to have numerous access points or opportunities to receive a COVID vaccine, whether it be with us through the health department or Atlantic General Hospital or the various pharmacies, or the mass vaccination site located at the Civic Center in our neighboring Wycomico County. If you are in need of help in scheduling your appointment online, we are here for you. Please do not hesitate to contact the Worcester County Health Department for assistance. We've been continuing to work with the Maryland National Guard Equity Task Force, led by our own hometown Brigadier General Janine Burkhead. Our local equity plan mirrors that of the state goals, which is to break down barriers to expand access and save lives in underserved, vulnerable, and hard to reach areas within our county. This has truly been an all hands on deck response, with staff from all departments jumping in to take on new roles. Thankfully, our public health emergency planning is a well-oiled machine, making us uniquely positioned to respond. Beyond our staff, we continue to receive incredible support from our partners throughout the county. One of my favorite sayings, and many of you have heard this before, is if you want to go fast, you go alone. If you want to go farther, you go together. Our public-private partnerships were far-reaching and not inclusive of this list. However, I just want to say special thanks to some that I know that are online. A big thanks to our county government for their continued and unwavering support, especially our emergency management. County Parks and Recreation Department, they have been an outstanding partner in allowing us to have our vaccine clinics every week in their building and support with their amazing staff. The town of Ocean City, I can't speak enough of them. The town itself and their emergency services, just an excellent partner. Atlantic General Hospital has been with us since the beginning. I don't know if Matt Morris is on, but he has been a great partner. The town of Pocomoke City, and of course the Elks Club, we're there every week as well. With this help and the extreme dedication of all staff, I'm happy to report some of the following milestones, if you can indulge me just for a moment. This was as of yesterday, April 6th. So as I spoke of our call center that we conduct and man here at the health department, the number of calls that we've received to date, almost 6,500. 6,493 calls that we have received through that call center. And it is a broad spectrum of inquiries and assistance. And staff have just done a yeoman's job in manning that and guiding people to get the answers that they need. The number of cases to date, 3,429 positive COVID tests. This is actually, we follow through the health department more than that because we also follow the rapid positive test results for COVID. So once you combine those two together, actually those that we've monitored through the health department for positives is over 5,000, actually 5,031. Speaking of monitoring, those that are currently monitored through our isolation and quarantine are 247. However, we've had an all-time high over this past year of over 1,000 monitored at one time. For a total that we've monitored through this past year, including cleared and closed cases, 11,261. You know, speaking of isolation and quarantine, for us, that's a 7-day-a-week commitment. We have staff on call 24/7 to attend to the needs of those that are in isolation and quarantine, to make sure that they have the supports in place to make sure that they're successful. The number of tests given to Worcester County residents over this past year, it's a whopping 79,741. This includes both the PCR as well as the rapids. Now this, you're probably thinking to yourself, well, you know, we only have over 52,000 people in our county. There are those that have been tested more than once. So that attributes to these higher numbers. So speaking of vaccines, the number of Worcester County residents receiving their first dose is a little over 20,000. It's 20,084. Which represents about 38% of the population. Number who have received their second dose is a little over 12,000 at 12,175, which is about 23% of the population. I'm also pleased to report, not only by our efforts, but with the tremendous work of our partners throughout the county. As of yesterday, April 6th, Worcester County is second in the state in the percentage of population receiving first, second, and fully vaccinated. Just an outstanding job, and you should be proud of our county. We also have the not so fun job, as it relates to the executive orders, is the enforcement side of the house. The number of COVID complaints investigated by our environmental health staff are 404 complaints. Now, you may have seen recently, well, a couple months now, we have had a statewide reporting mechanism. I receive every complaint that is lodged at the state level with concerns for any violations of the executive order, which is then sent to me, and then our team follows up and investigates those complaints. To end with the updates, I am pleased to say that as of yesterday, 4,789 of our residents have recovered from their positive test and being monitored through our agency. I celebrate these milestones with the entire community, I know including you, and I know that you will join me in applauding the effort of our heroes of public health. As you can see from the agenda, we have designed this conference around topics that are aligned with our current emergency declaration and public health issues that disproportionately affect rural communities. Dr. James McGinnis will discuss vaccines in communities of color. Eric Gray's presentation will cover effects of loneliness, and Mimi Dean will lead us through everyday coping activities for improved health and wellness. With this information, we aim to build bridges to better health and wellness in our community through continued collaborations with our partners and our community members. At the conclusion of our conference, you'll receive additional resources, upcoming events, as well as the most important, the evaluation. I will ask you to just please take a moment and complete that and return that. That's very helpful for us in planning our future public health conferences, which hopefully next year we will be in person. So with that being said, it is my great honor to introduce our next speaker, Dr. James McGinnis. From Atlantic General Hospital. He is the director of pharmacy and the co-director of the Medical Infusion Center. Dr. McGinnis's topic today, his presentation will be vaccines in communities of color, a presentation on the history of vaccines in communities of color, and learn everything you need to know about vaccines. I'd like to just share just a few things about Dr. McGinnis. He has served as pharmacy director at Atlantic General Hospital, where he has functioned as a pharmacist and director of the pharmacy programs for approximately 13 years. While at AGH, he has built a comprehensive pharmacy program during his tenure. He has redesigned and managed the construction of 3 pharmacies, inpatient, retail, which is their AGH Ready Scripts, and the pharmacy in the Regional Cancer Center. Prior to joining AGH, James built a consulting business with a wide variety of partners. James' past has included being the director of pharmacy, pharmacy clinical coordinator, national pharmacy clinical coordinator, and faculty at several pharmacy programs. He is a registered pharmacist in Texas and in Maryland, and has practiced clinical pharmacy in New Mexico, Indiana, Texas, and here in Maryland. James is a graduate of pharmacy programs at Texas Southern School of Pharmacy and the University of Iowa, and has served twice as pharmacy fellow and as a fellow in computer applications in pharmacy. His work was presented at several national conferences and to numerous academic and community organizations. James believes we are given gifts to serve. He believes his gift is pharmacy, and he willingly offers this service to benefit those who are around him. Please join me in welcoming James McGinnis.
First of all, thank you. I'd like to thank everyone for that. I'll try to get my presentation up on the screen here shortly. I'd like to thank everyone again for this opportunity to talk about COVID-19, viruses, variants, and communities of color. I'd like to have a conversation, if you would, a conversation of a nephew, a son, a cousin, a great-grandson, when COVID-19 hit, I took some time to reflect on where was my family doing past vaccine challenges. And hopefully you can see on the screen a picture of my great-grandmother. And during her lifetime, she was faced with bubonic plague, cholera, tetanus, and rabies. I'm gonna stop here and see if I can work on sharing my screen. And I apologize. Those who know me know that Zoom is my challenge.
Just see the header. I can't see her.
Okay, I'm gonna go on.
Now we got it.
And my coach. Again, here's a picture of my great-grandmother. And when COVID hit, I reflected, it was a personal reflection on where was your family? What were they doing? How are they experiencing this? And was it the same as it is today? So the next photo is a picture of my grandmother. And during her time, she faced tuberculosis, diphtheria, whooping cough, and scarlet fever. The next photo is a photo of my uncle. I have to say he has been incredibly near and dear to me through my lifetime. He was the coach when I was struggling to understand what my parents were saying to me. He was also the coach who attempted to teach me to play basketball, and sadly, he was the coach who attempted me to learn how to play the saxophone. All those other things he did pretty well at, except the teaching me how to play the saxophone. My story for him is a sad story. He came down with COVID. He died from COVID December 16, 2020. And if you recall, the first shipments of the Pfizer vaccine was 12/15/20. What is COVID? COVID is a virus. It is a disease caused by a virus. It's an infectious disease caused by what we would call a newly discovered family of viruses. I want to spend some time now as we shift away from just quickly defining COVID-19 to the things that are available and the things that challenge those things that are available. What is available to us? Public health initiatives and vaccines. How can we stop the spread of COVID? Basically, public health initiatives. Washing your hands, wearing a mask, and having some level of social distancing. Switching to vaccines, there's basically 5 types of vaccines. What I like to try to focus on are the new 2 types of vaccines that are available. One being the messenger RNA type of vaccine, which we would know as Pfizer or Moderna, or the new recently released Johnson & Johnson viral vector technology vaccine. Ultimately, these 2 vaccines work the same way. The messenger RNA vaccine works by introducing the messenger RNA sequence into our bodies. That sequence looks like the spike. Our body kicks into its natural immune working processes. It develops strategies like antibodies, T cells, B cells to attack that spike, neutralize it, and destroy it. The viral vector technology uses a kind of a different system, where with the previous strategy, that piece that entered into the body was encapsulated in a lipid cell, nanoparticle, if you would. Here, the Johnson & Johnson strategy is to place it inside of an adenovirus that has been basically made harmless. And that's how we deliver the piece of the coronavirus, or the semblance of that our body would recognize as foreign and will attack. And it's just, these are the ways that our body get the message that when you see that spike or the spike protein, develop neutralizing antibodies and kick in the immune response. And here's kind of a schematic for those of you who are into schematics of how this process works. We're faced with a SARS-CoV-2 infection. Our body kicks in an innate immune system. We have cytokines released. We have other kinds of cells that go about the business of killing that foreign body. B cells, plasma cells, the little kind of Y-shaped things or antibodies, they surround the virus and neutralize it. The incredible thing about our immune system is that it develops a memory system, if you would. So if I'm ever faced with this again, I know how to respond. I'll build antibodies, I'll have a cell type response, and we'll destroy that foreign particle, if you would, or the SARS-CoV-2 virus. And off to the far right is kind of a curve that says this is what will happen. We see an infection, we have a rapid response, but over time, we also have systems that respond so that if we have a reinfection, we don't have to start all over again. We're ahead and we're able to take out the, if you would, take out the virus. This is kind of an important question. as we begin to ask how long are the vaccines going to work? And there are a lot of folks working on that very question. Again, it's all about the spike. It's a wonderful way to characterize the virus that's caused COVID-19. It's a great target. And basically, that's the idea around the vaccines. That's what they've targeted. That spike material there allows us to build the vaccine. The vaccine teaches our body to recognize it as foreign. And once it's recognized as foreign, we'll go about destroying that target. And here's a picture graph, if you would. The spike is the red piece there. Here's again kind of another graphic that says to us, to our far left, we see the receptor that the COVID virus would attach itself to. Once it properly attaches itself to that receptor, the human cell membrane opens itself up to the virus. Once it opens itself up to the virus enters into our body. It tricks our body into producing only one thing that's important to the virus, and that's that virus again. It produces it over and over and over and over. The attachment is the infection. The idea of the vaccine is to put something in between, an antibody, that would change the shape of that spike so it doesn't fit on the ACE2 receptor, so it can't enter into the cell. And that's what this is all about. This is what the vaccine's about. This is what monoclonal antibodies are about. This is the whole strategy here. It's all about the spike and finding the way to block the spike from touching that receptor and entering into the cell. So nature being nature, and the virus has only one goal, and that's to replicate itself. And using its genetics and mistakes, it creates a set of mistakes called variants. And the variants that we're most interested in are those variants that are around the spike. And we've given them names, but this is a natural process. There are strategies we can use to prevent this, and we'll hopefully have some conversations about that. We have some definitions I'd like to try to go over quickly, because we'll hear these things in the media. Variants of concern. Those are the variants that are reasonably effective. They've made some significant change to the coronavirus, some that make it more lethal, some make it more transmittable. There are variants of interest. Those are the ones that we're going to continue to track. And then there's just mutations we're going to watch. I recently read an article about a set of COVID variants in India, where there were at least 9 distinct mutations around that area that produces the spike. And again, it is that spike that's most important because that's like kind of a key and a lock mechanism there to get into our cells. Variants that are of importance are the UK, South Africa. There's a New York variant, there's a California variant, and a Brazilian variant. I list out here the South African variants, and they all have numbers and nomenclatures and all of those things. But the important part is just to pay attention to what we hear in terms of the name. The UK variant is a variant that we've heard a lot about. South African variant, something we've heard a lot about. And in this state of concern is the Brazilian variant, and then the California variant. I have some questions I'm asking myself all the time as I hear more and more about the variants. As a reminder, the variants are global. Typically, we'll see the naming based on the location that the variant was first discovered. And then the kind of questions I ask myself, what is going on with that variant? Is it able to spread from person to person easier? Does it cause milder or more severe disease in people? Can we detect the variants? Are we studying them? Are we sequencing them so that we have the most knowledge that we can? What's our responses from the vaccine perspective to those variants? And does it change the effectiveness of the vaccines? And to date, they do not. Again, the story about the vaccines, we have 3 vaccines available to us in the United States: Pfizer vaccine, Moderna vaccine, and Johnson & Johnson. I would have listed the AstraZeneca AstraZeneca vaccine as one available, but today it is not available. As a betting person, I had hedged my bets and I had the belief that it was going to be able to be presented to the FDA, but with a number of if you would, missteps, that vaccine is not available to be presented to the FDA. So we hear a lot about comparing the vaccines. So I'll just cut right to the chase. All of the vaccines are equal when it comes to preventing death, severe disease, and hospitalization. And that's why we have the vaccines. In the picture graph I have here, we have the Pfizer vaccine being reported out having a vaccine efficacy of 95%, Moderna 94%, AstraZeneca 67, if you would, and Johnson & Johnson. If you recall, there was a person in the state of Michigan, I believe it was the mayor of Detroit, who emphatically claimed he would not accept the Johnson & Johnson vaccine because he didn't want 66% when there was a 95 and 94% vaccine out there, and basically refused it. He has since come around, but that was a misunderstanding. And I think as public health workers and those folks who are involved in communicating about the vaccine, I think the critical piece that we have to communicate is that the vaccines are all equal when it comes to the most important things: preventing death, severe disease, and hospitalizations. On the graphic here, in the pink area, I point out some of the things that help us understand why you really can't compare them. Most of it is time. Most of it is the population that the vaccine was studied in. As we move closer to our date, Johnson & Johnson is the most recently available and studied vaccine. It was studied in an environment where the variants actually existed. When you go back to the Pfizer Moderna, because of time, there weren't a lot of variants there. So in making a comparison, you have to make a comparison in the same span of time and under the same conditions. But what do we know? The walk away again, one more time, is that they're equal when it comes to preventing death, hospitalization, and severe disease. Okay, and this is a slide that just kind of says that. When you look at the numbers, we sometimes make the mistake to compare the vaccine efficacy numbers when we should actually be asking the question, does it prevent death, hospitalization, or serious COVID disease? What are some of the known side effects? Those of you who are on the front line administering the vaccine, you know these by heart, or if you've received the vaccine, you've experienced some of these: injection site pain, fatigue, headache, muscle pain, chills, some joint pain, and some fever. Basically the same kind of side effects you would have if you had experienced the flu. I put together here some numbers, and I don't have our county's numbers, and I apologize, but with the increase emphasis from the highest levels of our organization and country, we see ramped up vaccinations, ramped up availability. And this is the only way we're going to put ourselves in a place where we're reasonably safe from this virus. We have to vaccinate, but we also have to remember that it is through public health means, public health strategies like washing our hands, wearing masks, and distancing that will protect ourselves. And I say that again, even in face of the variants, those three strategies will protect us from the variants as well. We have some distribution models that we're using in this state. We're using some pharmacies, our hospital, Atlantic General, public health departments, and then we have the new mass vaccination clinics. They all have their disadvantages and advantages. Some are huge and can vaccinate a large number of folks, but are all communities able to access that? Public health is designed to meet all of our basic needs in terms of reaching out to folks. Hospitals, some of the strategies that Atlantic General has developed, working in partnership, much like the Public Health Department has, with communities that are specific, that have specific needs, and addressing those needs. And then pharmacies. This is a new area for public health initiatives, but an area actually that's historically very familiar to pharmacists and pharmacies. I want to call out this person, Kamika Colbert. And if there's anyone in my lifetime that I would bet is going to win a Nobel, it'll be this young person here. It is her work that was the foundational background for the Moderna vaccine and for monoclonal antibodies. Her work has been incredible. And I just want to champion her and say that she has done some incredibly great things. And she went to school in Maryland. Again, what medications exist to support our managing the COVID pandemic. I go back to public health issues, public health opportunities, social distancing, wearing a mask, and washing your hands. And then I come to vaccines. I'm going to switch. I'm going to switch kind of the viewpoint of the discussion going forward, and I want to talk about one of the areas I've spent a lot of time on, and that's vaccine hesitancy. And what are the sources of that hesitancy? And I would suggest some of that source is disparities in healthcare delivery. And I'm going to try to define racial disparities in healthcare as when people from different racial ethnic minorities are disproportionately affected by the lack of quality healthcare or health insurance, or are linguistically or culturally challenged inside of those healthcare organizations. When inequalities in treatment exist, they produce distrust, and that distrust can be in the government, or that distrust can be in the healthcare systems. And when those barriers exist, they contribute to poor health and poor health outcomes, which can limit our strategies around health promotion, reduction of disease, and injury prevention. Historical reasons drive distrust. They have an effect on outcomes, but communities come together for the good. There are great things that can happen. And I want to talk about a lesson learned at the end of this discussion. When I started down this path, thinking about what were the things that really was driving hesitancy, I went back and I did a little research, and known to almost all of us were the things that had happened in the past that drove distrust. But one of the things I was not aware of was Dr. J. Marion Sims, and he was considered the father of modern gynecology. But one of the disturbing things I found out about Dr. Sims was he, during the slavery period of time, he practiced and developed surgical procedures on enslaved women. And he practiced and developed those procedures, surgical procedures, when anesthetic agents, which were available at the time, were not provided. And today we would consider that act barbaric. One of the noted things was when Dr. Sims had perfected those techniques in the South, he later took those same techniques up to the North, if you would, using anesthetic agents to perform those same surgeries on women up north, white women. Another example, more recent, near past, if you would, one of the most infamous examples here. And when having opportunities to talk to folks face to face, one-on-one sometimes, I hear about the Tuskegee study. And if you recall, it was a study about 40 years. The men in the area of Tuskegee were studied basically because they had untreated syphilis at the time, and they were not treated at all, even when treatment was available. And basically, our government participated in this study. The participants not knowing that we're in the study and not knowing that there was a treatment. When I further looked into this, the men who were part of the study might leave that area, but for some reason, they never got the proper treatment. And that just says that there was some level of coordination here, and unfortunate. But we were lucky enough, a whistleblower in the 70s pointed this out and made us all aware of this. Again, through these disparities in healthcare, we produce a sense of no trust. Recently, let's say 2005, a company, Northfield Laboratories, wanted to bring to the FDA a blood substitute. Basically, it was a means to deliver oxygen in trauma situations. The Army was also interested in this product and backed Northfield Labs. The FDA around that time, let's say 2000, changed the rules around consent, around informed consent. And the rule change basically kind of went like this. If it was an emergent situation, the patient didn't have to give consent. Northfield Labs took advantage of that change and supplied their test blood substitute onto ambulances, trauma areas, in quote unquote 24 urban centers. As a result of that, when the data was reviewed, there was, of the 81 treated folks, 10 heart attacks had occurred and 2 deaths resulted in that. Community workers or community folks recognized this as a problem and called this out. And the solution from Northfield was, we will give everybody in the community who doesn't want to participate in the study an armband. And we would provide that armband to them. It took 1 year for the armbands to become available. And as a result, the product lost favor and was never approved by the FDA. And perhaps one of the most disheartening stories here in disparities in healthcare was the story of Dr. Susan Brown. Dr. Brown knew she tested positive for coronavirus, and this occurred last year in November. She could express and explain her symptoms. She went to a hospital and informed them that she was positive and pointed out her symptoms. She actually suggested a treatment, a drug, an antiviral, remdesivir. And the physicians, the white physicians who were taking care of her, thought she was drug seeking and did not start her on the classic therapies at that time. She asked that they perform a CT of her chest to help explain her pain and the fact that she was positive. And that was ignored. She eventually transferred from that hospital, but she did die eventually from COVID. All of these things combined to generate a sense in certain communities, African-American, communities of color, a sense of distrust. So when we come to these communities and suggest to them that taking a vaccine would save their lives, here is our hurdle. It is these historic things that are in the background of everyone's mind. An open question. When it comes to the vaccine, what is better? Age-based distribution or a distribution based on zip codes that have high indexes of economic hardship and poor access to healthcare? Open question. Partnerships with local healthcare institutions, communities of color, organizations, trusted sources of information, and faith-based communities are beneficial. They help us resolve those challenges of disparity, if you would. Should we set up some system as a part of those distribution groups, MaxVax, public health, pharmacies, hospitals? Should we set up a sense of a priority to distribute the vaccines to folks who face mobilization issues, transportation issues, access to computer issues? Should they be given a priority? Should they be able to move to the head of the line? Because of those challenges, they end up moving to the back of the line. If I only have a cell phone and I'm trying to get onto the website to allow me to sign up to get a vaccine, and I don't have 5G, and I may only have 3G, and the person who lives in a home who has high-speed internet, I'm going to lose to them every single time. And all things being equal, that creates a difference. And the last open question, is there a way to simplify the registration process and decrease the technology barrier? Racial disparities, I'm going to spend a few minutes here, and then I'm going to try to go on and talk about what I consider some incredible successes. What are the outcomes of these disparities? We know that Blacks are dying in a disproportionate amount. When we look at the deaths per 100,000, if you look at the graph, this is a national graph, it's two times. When you look at people of color, the last three bars on the right, it is a disproportionate, upwards of 2.5 times, 2 times at least, in terms of deaths and compared to white. In Maryland, the top bar represents African American or Blacks. And this was this graph for me represented the most obvious outcome of disparities. Declines in life expectancy. The CDC performed some studies the first 6 months of the pandemic, looking at what was the expected change in life expectancy. And what we saw was American men lost 1.2 years. Americans in general lost a year. American females, these are on average, lost almost a year. But when we look at African Americans, the loss in life expectancy was 2.7 years. Sometimes I ask the question, when is equal not equal? If we go back and rethink about, have a moment and image the vaccines, we had that kind of an equal is not equal. All the vaccines have an equal outcome, but the numbers are not equal. When we look at disparities and look at communities and look at the question we're asking our communities, it's particularly around distribution. Would you trust an organization that mixed up an ingredient for a critical vaccine? Would you offer that vaccine if it was reported to cause blood clots? And would you work with organizations that create ways that you perceive they create a disadvantage to you? These are our questions around hesitancy that we have to address. Factors that increase healthcare inequities, access to healthcare organizations and utilization. Our occupations drive the fact that we may have insurance coverage or not. Education, income, and wealth gaps drive these inequities. And housing, where do we live? If we're rural, those accessing the healthcare system is going to be a bigger challenge. If I don't know I have a disease, literacy, I won't access the system. If I have a job that occupies a part of the day when the healthcare system is available, I won't get access. Local lesson. Distribution, the big chance. When we look at things like social vulnerability indexes or social determinants of health and incorporate those into how we go about distributing, in this case, vaccines, I think we benefit. When we involve local communities of color in making distribution decisions, we lower that barrier, we lower that hesitancy, we gain access. And when we involve communities of faith, we have a trusted agent, someone that the community will believe in. And when we have healthcare organizations who believe in leaving the walls of their hospital or their clinics and going into the community, we again lower those barriers. Atlantic General and the Partnership for Faith in our community, St. Paul, and a number of churches in the county took on one of those challenges. And I think by taking on that challenge, this group of folks, they created a lesson learned. The historical lessons learned in the area of reducing health disparities are basically around three things. They call it the 3 T's: time, technology, and trust. And I'm going to add a 4th T, and that's transparency. Time, communication from both sides of leadership, or sometimes 4 or 5 organizations come together and have communication, but it takes time. And the communication has to be horizontal and it has to be equals. Technology. We have to find ways to lower the technology thresholds through community-based, and I'm going to say this, community-based enrollment, and enrollment into ways to access the vaccine. And trust. Making sure there is a shared commitment for the mutual benefit of all. And the idea of trustworthiness is the other person or other organization on the other side worth trusting. And then transparency. Is everybody being really transparent when they come to the table? Time, generating a sense of trustworthiness. That can only be gained through time and open communication, generating a sense of shared vision, and generating a sense of resilience. Things aren't always going to go right. But if I trust you, and if you're trustworthy, I'm willing to let the little things go for the benefit for the all. Technology. Working to resolve the technology barriers of, we'll say, enrollment into the programs that gain access to the vaccine. Again, my cell phone versus high-speed internet. Working to resolve what I call systems viewpoints. Sometimes we will bring a systems viewpoint as a solution to a problem that has cultural perspectives. And sometimes the system's viewpoint is incompatible with that. And by that, it strains trust that has been gained through time. And then we have to work on resolving the fear of the technology, the unknown. Why do you want my mother's maiden name? What are you going to do with it? Getting back to trust, working to be trustworthy. I think this is the most important walk away of lessons learned, is working to become trustworthy. And that's both the organization is delivering this opportunity, be it the community, be it a public health organization, be it a church, be it any group. Understanding the risk, and that's a risk that the group face together, not the risk of the vaccine, the risk of partnering with you. We have to understand that risk, and we all have to understand it and share it. And then finally, we have to have a commitment to the future. Yes, this has been a discussion about my family and a discussion about vaccines, a discussion about how do we deliver those vaccines. But ultimately, this is about a community. And how do we get these life-saving products to that community? How do we resolve years and years of distrust? We do it through a commitment to the future. And transparency. Why are you here? What do you want? You're asking me to do what? Those questions have to be put on the table and asked and answered. I would suggest, again, please, for those who have not gotten the vaccine, get the vaccine. For those of us who are involved in encouraging them, those folks to get the vaccine, let's work really hard. When we have hesitancy, let's put trusted communicators out there in front of those folks. And that could be communities of color, but I'm also seeing more and more information around some of the evangelical churches are becoming more resistant or hesitant to taking the vaccine. How do we craft a message to them? How do we craft that same message to them? Because without them getting vaccines, without them getting vaccinated, our global risk doesn't go down. This is what success looks like. This was a community of color, AGH, community of faith initiative. This coming Saturday, we will have vaccinated approximately 500 folks through this initiative. And the initiatives like this are going on all over, but this is one that's near us. The young man seated is 100 years old. And every time I think of him, I just have incredible joy. 100-year-old man getting a COVID vaccine through partnership. I'd like to open it up to questions, if you would. Thank you. Thank you for your patience.
Excellent work, Dr. McGinnis. There were a couple questions posted in the chat. I'll just go ahead and read them to you if you have a second. So I didn't paraphrase them, but I didn't copy them word for word. So if anyone needs to correct me or has any additional follow-ups, just go ahead and post them in the Q&A or the chat, and we'll relay them to Dr. McGinnis. So James, the first question is, how is the education on COVID vaccination of the incapacitated at home with older residents approached? How are we reaching people, especially when they might be living alone without support, to get vaccines to them?
Yeah, I think I think that is an incredible challenge. We've had, I know the group I'm closest to, we've had a number of conversations around how do we reach what we'll call the shut-in, the folks who are by themselves. I think one of the established tools is to use these communities of faith, if you would, use the churches to communicate the message. Um, at least the initial message to say, hey, the vaccine is beneficial. If there's resistance at that point, bring in folks who may be able to work through the hesitancy questions. Um, some of the questions I recall getting are just kind of basic inquiries. I have cancer. Is it safe to take the vaccine? Um, I'm considering getting pregnant. Is it safe to take the vaccine? And this in the younger audience. Um, I have various neurological diseases. Is it safe to take the vaccine? I think at the one-on-one level, those are the questions that have to get answered. But I think having someone who is trusted, someone who knows that individual or a small group of individuals, begin the initial conversation. And then if that doesn't convince them, bringing in folks who may have a little more knowledge to address their direct question.
Fantastic response. We have two more questions. Here's a great one. How are we reaching out to immigrant communities, Spanish, Creole, everything locally, who might not speak much or any English? How are we building trust? And in fact, for today's theme, the building bridges in the community, how are we connecting to these groups who might not be able to speak English very well? What type of outreach do you know that public health is doing, whether it's Atlantic General Hospital or anyone else?
I think we're beginning to do that. My understanding is that the group, public health group in the county is doing some initiatives of reaching out. I know it's one of our priorities to reach all communities of color. That would be those who speak English as first language and those who do not. But it's formulating a strategy. It's formulating a strategy that's culturally appropriate and trying to find out what are the basis of their hesitancy, if there is. For some communities, we have to understand there may be basic hesitancy around their immigrant status and finding ways to deliver that vaccine that doesn't violate their belief, true or not, of that challenge. We just have to make sure that delivery is culturally competent. I think I know Atlantic General and I know that the county health department are reaching out to various communities.
Yeah, I will say just from the county health department perspective, we do tons of outreach. As you mentioned earlier, a lot is done through faith-based. We have translation options for people who call in and might need to speak to someone in a language other than English. We do a lot of different material, and this trickles down through the entire state. For Maryland Department of Health in multiple languages. And it's something where we're really trying to reach people where they are and to connect to people with whatever information that they need. We have another, I think, really fantastic question, and it's a tricky one. How can we decipher fact from fiction in public health, specifically for vaccine hesitancy, but really for any of it, because there is so much misinformation floating around. And does public health sometimes become politicized and politics have an influence in what people are believing?
Oh boy, that's a lot to unpack. So I'll start at the beginning of that. I know initially some of the hesitancy around the vaccine was, oh, they're going to put a microchip in me, or oh, this is going to cause me to become impotent, or oh, this is going to, there's a whole list of those. And I think fact-based conversations are important. And it's critical that we deliver the facts. But I think a lot of that gets back to, if you would, the disparities and the history of groups who may be asking those questions. So I think in combination of resolving the specific question, we have to address some of the other hidden kinds of things not being said. Can you help me? That was the latter part of the question. Can you bring the other two pieces to me again? if you would?
Yeah, and it's something that we hear a lot, and for the communication side of it, how do you separate fact from fiction in public health? How do you deal with all of the misinformation? I know just as a public affairs officer, we see so much stuff on social media that's questionable. There's information that is posted as if it was fact without any crediting or sources on there. So I know from our end, a lot of it is we really try to hammer home through repetition that you need to look for reliable sources. You need to find outlets such as the health department, such as Atlantic General Hospital, CDC, areas that are consistently audited and transparent. And then you look for that information and just be very careful about believing opinion that is presented as fact, especially because social media lets that stuff spread like wildfire.
Yeah, that brings to mind, I just took a note to make sure I speak to these two things. It brings to mind something that I'm becoming increasingly aware of. And one of those hesitancy areas is in the area of the evangelical churches, having some back to facts and fiction, having some challenges with the cell line that the vaccines are produced out of. The leadership of those churches have endorsed the vaccination process, but many of the folks inside of the various churches are still hesitant around the cell line that produces the vaccine. And I think those folks who are going to engage those communities have to be aware that that's one of those challenges. The challenges may not be historical, the challenge may be an ethical challenge. And how do we go about resolving that? If I believe that cell line that produced that vaccine is a cell line of an aborted fetus, is that true or false? And tell the truth when we answer that question. Another example of this fact or fiction is around the idea of vaccine efficacy. The story was never completely told. We wanted to get to the quick thing and compare a couple of numbers, when in fact, the comparison should have been around, am I going to die? Am I going to be hospitalized? Or am I going to have serious illness? That's the story, not the story of 95 or 94 or 66 or 62 or whatever. At that point, if I'm alive and I'm not in a hospital, I'm not suffering from severe disease, the vaccine has done its job. So I think being honest and listening and coming to the question with a sense of understanding the ethics and the culture of folks, I think that's how we begin to resolve it. And communicating in a way that's horizontal, not delivering science speak when folks aren't able to understand science speak. Make it a conversation, make it understandable. Speak the language of the questioner.
Fantastic answer as always. And I did want to jump back to that previous question we had about how we're reaching non-English speaking citizens. Jennifer LeMaitre, our planning director, just mentioned that there's a vulnerable task force out of Salisbury that's doing tremendous outreach with non-English speaking citizens. So I think that's a great point and really highlights the theme again of today with the Building Bridges, is that this isn't just the hospitals doing this. It's not just the health department. It's really the entire community, private and public organizations forming these partnerships. A lot of different great grassroots groups taking on these challenges as well. And I think in Worcester, we're very uniquely blessed in how much everyone is willing to get involved with different public health concerns.
Yeah, I would agree. I think we are incredibly fortunate to have all of the partners here in alignment. I would guess that that's not true throughout the rest of Maryland, but we are unique. This part of the state is unique in the fact that we've created partnerships and alignments with each other. And that's probably why, if you would consider, we're ranked as high as we are in terms of the level of vaccinations. We're resolving these questions of distrust. we're delivering the vaccine basically where the folks are. We're developing and testing and creating ways to create clinics, resolve technology barriers, create trustworthiness as organizations. I think we're unique, and I think we should tip our hat as a group, as you would, to our hard work, both on the community side and the folks who are getting vaccinated, and to the workers who are delivering the vaccine. And I want to say thank you because I've been vaccinated, and I want to thank the person who vaccinated me. So
When I got mine, I thought that they might have chosen a larger needle on purpose because it seemed very intimidating. And I was like, were you using that on everyone? Or is that just for me? But they are doing a great job. I think that AGH has been fantastic. I think the Worcester County Health Department, our clinics have been running so smoothly. So many people in our community, like Elks Lodge in Pocomoke, all the local towns, municipalities, Ocean City, Ocean Pines, Berlin, Pocomoke, Snow Hill, just been opening up the space for people. They've been supplying volunteers. It's been really fantastic to see with the vaccination clinics how everyone is coming together on this. And I think that also talking about the misinformation side of it, people in the community have also been talking to each other and trying to have these conversations. I love seeing it on social media where we might put some information out there, have some questions in our comment section or even false information, and then other people will correct it and then they will put their sources there. And it warms my heart to see everyone taking this collaborative approach and trying to make sure that everyone in Worcester knows the facts about the vaccines. If they have hesitancy, that it's addressed, and if they want a vaccine, that they have the opportunity to get one.
Yeah, I think that's fantastic. And again, I want to thank everyone.
All right.
Helping us.
Absolutely. So let's see. I'm going to bring us back to the main screen for everyone. I
Hey,
think that,
Travis.
yes, ma'am.
It's Becky.
Hello, Becky.
Jump in? Dr. McGinnis, thank you again so much for your presentation. We appreciate your time and all your work you're doing in our community to keep us healthy. I just wanted to jump in really quick on one of the questions regarding the homebound population. For many of you, you may or may not know that, again, we're very fortunate here in Worcester County to have a Maryland Access Point, which is a collaborative between the local health department, Department of Social Services, and our Commission on Aging, which has been a co-facilitated, co-located initiative since 2005, I believe. So as part of that, you bring all those disciplines together to reach our most vulnerable populations, those that are of aged or disabled. So for many years, we've had a homebound plan for vaccinating for flu vaccine every year for those that can't get out for a variety of reasons to our clinics. And our clinics, I'm speaking globally, whether it's the hospitals, whether it's the health departments, whether it's the pharmacies. So we go to them because that's what we do in public health. So I just wanted to give an update to the group that as of today, we have made 58 home visits for those that cannot come into any of the clinics. In addition, when we're talking about our most vulnerable, that's our nursing homes, our assisted livings, and our independent livings. Many of you may know that the large chain pharmacies were charged with the responsibility of vaccinating the nursing homes, which I'm glad, very proud to report in Worcester County, we are at 100% for those who wanted it. Early on, I want to say back in January, and my executive team, you can kind of push me back if my memory's off a little bit. The state came out and said, the large retail pharmacies may not be able to accomplish the assisted living or the independent living. Well, guess who was one of the first to raise their hands? We were to say, look, we're going to come and we're going to help because we need to protect this vulnerable population. So we moved out, connected with our longstanding partnerships. And, I'm pleased again to say that all of the assisted livings and independent livings have been reached and vaccine has been offered and given to those that were wanting the vaccine. We continue to revisit with the managers of each of those facilities to encourage, if people have changed their mind, which they do, and then they decide, yes, I in fact would like some vaccine, then we go back out to them again and we'll vaccinate them. Our only limiting factor, which you're going to hear me say this a lot, you've probably heard me say it before, and I think Dr. McGinnis will concur, is our vaccine allocation. I can speak, if I can take the liberty, Dr. McGinnis, and just say, Atlantic General has a capacity to actually vaccinate many, many more than what their allocation they receive every week. I can speak to that for the health department as well. Our capacity is so far outreaching our weekly allocations. So we could do more, we just keep waiting for our vaccine. And I think I can, again, take the liberty and speak for us both, Dr. McGinnis, that we don't let vaccines sit on our shelves. As soon as we're getting it, we're moving it out. So, I am proud for our county in that respect. Too. So I didn't mean to jump in.
Oh no, I greatly appreciate it, and
I
I would agree with the comments on the vaccines. There is no vaccine setting on any of our shelves. We're, like you say, we're giving it as quick as we can. And I thank you for pointing out some of the other efforts some of the other communities are involved in. Thank you so much. Again, thank you everyone. This has been a great experience. And I like having the opportunity to share our stories, all of our stories. So thank you so much.
Thank you, Dr. McGinnis. I think that was a very enlightening presentation that you gave there. And the way that you and Becky both responded to those questions was fantastic. We have a short break coming up. I did want to also mention, though, that in terms of like the vaccine response overall, one of the greatest things that I saw monitoring social media was the shift in tone over the last couple of weeks. There was a lot of anxiety, and there's still some of that, and frustration with the system. I know that a lot of people really wanted their vaccine and weren't able to get it, but now that supplies are increasing, and I think that with people who are actually operating within the system and getting to meet the people who are running the clinics and the hard workers there, the overall shift in tone on social media has been wonderful. There's a lot more positivity. People are very encouraging, trying to help each other sign up for vaccines, trying to help their family get vaccinated. So it's a great, just a team approach. We are going to take a short break. We'll be coming back at 10:10 a.m. In the meantime, the meeting will still be running. We're going to have some of our different videos, public service announcements, and just some really fun content running while we're on break. Then as soon as we come back, we'll be presenting the 2020 Debbie Geller Excellence in Public Health Award, followed by The Effects of Loneliness by Eric Gray. So Summer, if you want to go ahead and start sharing.
I had gotten sick with COVID. So after that, and after what I felt, I don't want nobody to feel what I felt.
My reason is because of the love for my family, the love for my community, and just how much I love social interaction.
This is going to help us stay safe. If it's going to help us keep us healthy, then I put my trust in it.
So that we can get back to some sort of normalcy, whatever that may look like.
To schedule your COVID-19 vaccine, please visit marylandvax.org. If you need help scheduling your appointment, please call 667-253-2140.
Hi everyone, welcome to What's Cooking in Worcester, a cooking series featuring nutritious and delicious takes on some of our favorite recipes. Winter is right around the corner, so that means cold weather. And if you're anything like me, there's nothing I enjoy better on a cold day more than a hot bowl of soup to warm you up and take the chill off. However, a lot of the store-bought canned soups are very high in sodium. You can tell this by looking at the nutrient facts. So let's look at two different popular soups. Anything about 20% or over your daily value is considered high. Anything below 5% is considered low. This first can has about 28% of your daily value of sodium. The second can has about 39% of your daily value of sodium, but it also has 2.5 servings. So if you eat 2.5 servings, which would be the whole can, you would really be getting 97.5% of your daily value of sodium. The good news is the recipe I'm going to be sharing with you today has only 6% of your daily value of sodium in 1 cup. First, I'm going to cut and prepare all of my ingredients. So here I have 2 carrots, peeled and chopped, 1 large onion, chopped, 1 cup of chopped cabbage, green cabbage, and then 1 medium zucchini chopped. Now, if you hear me say chopped and diced, the difference is chopped is a larger piece and diced is a smaller piece. So now that I have all of my ingredients chopped and prepared, I'm just going to give my pot a light coat of cooking spray. So now I'm just going to turn it on to low heat. I'm going to add my carrots and my onions. I'm going to add my broth. You can do chicken broth or you can do vegetable broth. But when you do buy the broth, try to choose the lower sodium option. So I'm just going to add this in. Then I'm going to add my chopped green cabbage. Next, I'm going to add my cut green beans. Again, you could probably find a no salt added option to make this healthier, not drained. So we're going to add the liquid and the green beans right into the soup. I'm going to add my 1/4 teaspoon of garlic powder and my 1/2 teaspoon of Italian seasoning. I'm going to turn the heat up to a medium-high and bring it to a boil. After we've brought it to a boil, we're going to reduce the heat to low and cover. We'll allow this to simmer for about 15 minutes or until the carrots are tender. Then we'll stir in our zucchini. Okay, so it's been about 15 minutes, so I'm going to check my soup here. And you want to cook it about 15 minutes or until the carrots are tender. So we're going to add the zucchini in next. One thing I want to mention too is I use the yellow onion for this recipe. Usually yellow onions are better for soups and cooking. So cover it again and simmer it for about 3 to 4 minutes or until the zucchini is tender. So once everything looks tender, we can go ahead and turn the stove top off and we'll go ahead and serve it up. Really good.
I have faith over fear. So I just took the vaccine because I just thought it was something that was going to be a positive impact for me. I chose to get the vaccine because it's just simply needed. I really thought that it was something that was a necessity. I have a family. I want to protect my family. If this is something that's going to help us, I'm all for it.
To schedule your COVID-19 vaccine, please visit marylandvax.org. If you need help scheduling your appointment, please call 667-253-2140.
Hi everyone, thanks for tuning in to find out what's cooking in Worcester. Today we are making a delicious strawberry smoothie. With only 4 ingredients, this recipe is super easy, inexpensive, healthy, and it's delicious. Smoothies are very versatile. You can have one in the morning as a healthy way to start your day, or as a guilt-free treat to satisfy your sweet tooth. So let's get started. This recipe calls for unsweetened almond milk, frozen strawberries, a large ripe banana, and flaxseed. For this recipe, I'm using ground flaxseed rather than whole flaxseed. Ground flaxseed is more easily absorbed than whole flax seeds, so you're able to benefit more from it. Flaxseed is loaded with nutrients. It's high in omega-3 fats, it's rich in dietary fiber and helps with digestive health, and it's a high-quality protein. So next time you're in the baking aisle, be sure to grab some. So all I'm going to do is place my 4 ingredients in the blender. It's that simple. Super yummy. You gotta try this at home. Thanks for joining us today, and remember to eat healthy, be active, and prevent diabetes today.
The Ocean City Out of the Darkness Walk is something that was first held in 2012. It's called the Out of the Darkness Walk because the purpose is to really bring these things into the light, to get people talking about mental illness and to get people talking about suicide. We know that people come out and they walk for different reasons. A lot of people come out in remembrance of loved ones who they've lost to suicide. People wear different colored beads to identify why they're walking. So many people struggle and they suffer in silence with their depression or thoughts of suicide, things that they feel like they can't talk about for fear of being judged or misunderstood. And that's really one of the things we want to do with this walk. We want to get the information out there. We want to make it okay for people to talk about the things that they're struggling with so that they can reach out and get help. People come out and walk for a number of different reasons. We know that everyone who comes out to walk has a different experience and a different reason that they're there. But ultimately, we're all there for the same purpose. We show up to make a change in the world. We show up to get the community talking about suicide and about mental health, but they don't get talked about nearly enough, and we really, really want to get the community talking. So it's a little bit about raising some money, but it's also very much about raising awareness and reducing stigma. And that's really what we aim to do with this annual event.
All right. We've got a couple minutes left for people to trickle back until the break officially ends, but I think we're just going to kind of start slowly rolling into it. Next, we'll be presenting the award for the Debbie Geller 2020 Excellence in Public Health. But before that, our health officer, Rebecca Jones, has some words to share prior to us showing the actual award. So, Ms. Jones, you can go ahead and take it away. Unless you actually listened to me and thought the break was until 10:10, in which case we're going to wait for you to return. And oh, there she is. Okay, thank you.
Hi, no, I'm here. I'm back. So yes, thanks, Travis. I wanted to share some words with you all from Mandy Geller, Debbie Geller's daughter. Unfortunately, she cannot be with us. As you may or may not know, Mandy is serving us out at sea, and unfortunately couldn't video or be here in attendance, but she did send some words that she would like me to share with the group. And if you all had the pleasure and the honor of knowing Debbie, she was an amazing leader, and could keep a pretty stiff upper lip, better than myself most of the times. But I can tell you, she loved public health with all her heart. It was her passion, but it came in second place every time to her daughter Mandy. And if you ever wanted to see a big smile and sometimes a little tear, when she was speaking of Mandy's amazing accomplishments, she was so very proud of Mandy. So if you can just indulge me for a few minutes, I'd like to share these words from Mandy Geller. Welcome and thank you for allowing me to voice my support for the Debbie Geller Excellence in Public Health Award. It is a great honor that the Worcester County Health Department has selected my mom's name to be carried forward in such an inspired way. Mom always found joy in her work. She was committed to excellence in public health, the community, and the people that make up the team of the Worcester County Health Department. She also still found time to be a caring wife and an unbelievably supportive mother. I hope that this award continues to inspire others to find excellence in what you do and who you are. Ms. Colleen Waring, the 2020 awardee, is an inspiration to all through her leadership at the Atlantic General Hospital and with the countless committees and teams she served on. I know that my mom is honored and proud of Colleen. For the 2021 awardees, wow, this is exactly what my mom would have wanted to see, honored as a team because you found a way to come together as a team during an extremely challenging time. Take a minute to enjoy the recognition. You more than deserve it. This is for the team, recognizing the team's excellence. Enjoy it. And that's from Mandy Geller. Thank you for that, Travis.
Thank you, Becky, and huge thank you to Mandy. And I'll go ahead and roll our wonderful award video for Colleen, who is just one of the loveliest people on the planet, such a hard worker, and a completely deserved winner for the first ever Debbie Geller Excellence in Public Health Award. So if you bear with me for a second, I'll go ahead and share my screen with sound and hopefully get it to work. All right.
Good morning. We are coming to you from the Worcester County Health Department on just a joyous occasion. We are here with Colleen Waring, and it is my honor and pleasure to award her today with the 2020 Debbie Geller Public Health Award. We're going to talk a little bit about Colleen and why she is so deserving of this award in remembrance of Debbie Geller. As many of you may know, Colleen served Worcester County for over 20 years, served our community through Atlantic General Hospital. She was Vice President of Patient Care Services while she was there, and that encompassed many departments and activities. She oversaw the critical care and medical surgical nursing units, the emergency department, the surgical department, respiratory, anesthesiology, physical therapy within the hospital. But her services extended well beyond those borders, and that's why she is so deserving of this award. Colleen, in her role in community and population health, was very diverse, and how she intersected with public health and worked not only with the Worcester County Health Department, but with many community agencies within our county. Colleen served on our local health improvement coalition, our patient-centered medical home, drug and alcohol council, opioid intervention team, resource coordination committee, network of care, mental health advisory, and public safety net, integration of public health, integration of behavioral health services, chronic disease care coordination, and Safe Station steering committee. Has also been very active in the community through her involvement as the chair in the annual Walk for Recovery, the Atlantic Club Board of Directors, and the Worcester Warriors Against Opioids Board of Directors. Since Colleen's retirement, personally she is passionate about her family, grandchildren, travel, sailing, and fishing.
Thank you so much, Becky. I mean, this is really quite an honor. To have an award with Debbie's name on it. And before I start, I do want to just say that, you know, we've had a rough year over the last year, and this was pre-COVID and pandemic, and I want to thank all of the heroes that have kept Worcester County, especially you guys, safe over the last year. I just am so honored with Debbie. You know, I've been on the shore, I've been in nursing for over 4 years, and I've worked on the shore the whole time. I've met thousands of nurses and healthcare providers, and there's a handful though that just really hit my core, and Debbie was one of them. And she instilled a sense of elimination of suffering and health and well-being, and she really formed a core that I didn't have. When I went to school, I had public health, but that was it. When I worked in other communities besides Worcester County, they were separate from acute care. Really, the two never came together. But we are so fortunate in this county. It is such a symbiotic relationship between all of the providers, acute care and public health. And that's what makes us healthy in Worcester County. It really brings strength, efficiency. It really was an amazing journey. And I do believe that was Debbie's leadership and then teaching me and bringing me along. So that was a gift she gave me. And when Debbie and I weren't talking about public health or the hospital, because she was on the board, we were talking about our daughters. Yeah. And we're so proud of our daughters. And I loved her daughter with I loved her being a captain of a huge ship since I'm a sailor. And but anyway, I think my passion for addiction and mental health, and you can see that in some of the things that I'm still involved in. And it really comes from the fact that I just believe that we all have the opportunity to be the best, but that's an illness that seems to take so many people out. And so for that, I'm grateful that I can still be involved in the community and still be out there trying to make sure people understand their solutions. So thank you so much for the award. I miss Debbie, and I just want to thank her family for what an honor. Yeah. Thank you.
Congratulations to Colleen. Absolutely lovely human being. Very well deserved winning that first award. Speaking of lovely human beings, I'm going to go ahead and introduce our next speaker, who is the current director of behavioral health at the Worcester County Health Department. And that is Eric Gray. He's got a small alphabet under his name. He's an LCSW-C, which sounds like a very cool designation if I knew what it was. I do know, I know. So he's going to give us a presentation on the effects of loneliness. So join Eric as he speaks about the effects of loneliness and isolation brought on by the COVID-19 pandemic. Eric has over 25 years of experience providing services to multiple populations in multiple settings, including residential treatment, individual, family, and child therapy. He is currently the program director for behavioral health services at the Worcester County Health Department. He's provided training in the areas of interviewing, stages of change, working with challenging populations, writing effective goals and objectives, social integration, working with rural homelessness, grant writing, and staff supervision. Eric, the floor is all yours.
Thank you, Travis. Does this mean people can actually see me?
Yes, they can see you.
Oh, that's wonderful. I'm going to share my screen. See if I can do this correctly. I'm going to make sure I have. And do I need to swap it?
Yeah, I think we want to swap it.
How's that?
Perfect.
Fantastic. First, I'd like to say I would rather be with all of you. I much prefer to do this in person. And I'm sure by next year we will. This presentation is about loneliness, and it's kind of broken up into a couple parts. But the reason I'm doing this is because for years, I've been talking about, or been saying this one thing in a lot of trainings and staff, especially our addiction staff. And I talk about the idea that when we're dealing with folks who have substance abuse disorders, that loneliness kills more people than the substances themselves. And I've been saying that for years. And then Jennifer asked me to do a presentation on loneliness. Thank you, Jennifer LeMay. And I thought to myself, well, I probably should know why I keep saying that. And I started doing some research and looking into what this meant. And we're going to talk about both what loneliness is and what it isn't, some causes, and then we'll get to a question that will, at the end, where we talk about the why. And I think that's really important to know. So I'm going to move us forward here. Hopefully this works well. So did you know, now let me just be clear. This presentation is going to be, we're going to have some participation in this. So if you have, when I ask you a question, which I will, there are quizzes and tests and all kinds of stuff. Please put your answers in the chat box or question and answer, either one, we'll get to them. But there will be some question and answer. This is the best I can do interactive. This is why I like to be in person, because I like to have some immediate feedback. So we will do that. You can save, if you have other questions, you can save them for the end, but that's fine. Or ask them as we go. I believe Travis and Summer will be kind of monitoring that, or Jackie or somebody. And at the end, we can have some question and answer as well, or you can just contact me and I'll make sure my contact information is available. So did you know that 70 million prescriptions written for antidepressants? That number has doubled in the last 10 years. And during that same period of time, more folks identify as suffering from loneliness. In fact, every year that I've been alive, depression, anxiety, and loneliness has increased. And what we know now is that all three of those things are very much connected. And I'm not going to read to you the whole time, but here's your first quick survey. So if you could, let me see if I can see the chat box. Well, you guys are going to monitor this because I'm not 100% sure I can see it. Have you ever felt alone in a crowd? Or have you ever felt alone while being in a relationship? Thank you. So if you would, just say yes or no. We won't, disclose too much of your stuff here, but has anybody ever felt alone in a crowd?
So it's in chat. I don't know if you're looking at the chat box, but there's a lot.
Anywhere. Is there anybody chatting?
Oh, there's a ton of people chatting.
Oh, good. Thank you. How do I see this?
So we see lots of yeses, yeses, yeses. One no, but a couple, well, lots of double yeses. I'd say we've probably got about 15 or so people that posted.
Absolutely. And before I go further, one of the things I want to talk about is this, and this is very, very important. And my presentation is really about, it's supposed to connect us with what, how the pandemic has affected us. let me just say this, and I want to make sure everybody understands where I'm coming from. I look at depression and anxiety as a continuum, and we're all on it somewhere. And I can tell you from my own personal experience, and I will speak to this several times during this presentation, that during this pandemic, my movement on that scale has gone from less depressed to more depressed at many, many times. So, you know, it is natural for us in what we've been through to do that. And I have had to kind of reevaluate how things have gone during this pandemic just for me. So I want to make sure I'm clear about what I mean by that. So, you know, when before the pandemic, I felt this certain way. And then after the pandemic, and certainly 6 months into the pandemic, I was more depressed than I was at the beginning of this. It's very natural for us to feel that way. So I wanted to make sure I got that out there first. We'll come back to that later on in this presentation. So lots of yeses. We've all had that feeling, or many of us, some no's. We've all felt, or many of us have felt alone in a crowd or felt alone in a relationship. And I'll talk a little bit more about that in a minute. We're also going to talk about the why. And if you could, I'm not going to read it to you, but take a second to read this. And am I yelling at you yet? Because I feel like I'm yelling. And I can't see the comments, so.
No, no one. You sound perfectly on pitch.
Okay, thanks, Travis. Oh, wait a minute. No, that's just. Okay. Anybody understand that comment that I just put up there? Gotta love having boys. And no, I've never still got a good answer to why he stabbed his brother with a pitchfork. Why questions are fun. But in this presentation, we're going to address a little bit of the difference between alone and loneliness. We're going to look at the effects of loneliness on our health and wellness. We'll review the positive and negatives of social media. And I put on there mostly because this is fun to do. Social media is, we'll talk about it. And finally, we're going to look at, again, the why of loneliness and briefly discuss, and this is kind of the second half of this whole presentation is based on this fellow Johann Hari's work on the 9 causes that ultimately leads to depression and anxiety. And I want to thank Jennifer LeMaid for introducing me to Hari's work, because it's pretty cool. What if you get a chance, and I'll reference the book several times that he's written, but he also has done many presentations on the effects of loneliness and depression and anxiety. So here's another pop quiz, people. How many close personal friends and family members do you have? And these are these people that you would feel comfortable calling to bail you out of jail, or worse, help you move, because there's a real friend right there, or watch your children overnight. So Travis, you're going to have to help me because I can't see the comments.
I'm on them. All right. So we've got a 12 to 15. Well, yeah, I know. Very popular. We've got a 10. We've got another 10. We've got a 2, which is probably, I'd probably put myself at about a 2.
Okay.
I've got a girlfriend and a dog. We got 5, 3, 1, 5 to 8. I like people putting ranges in there.
5 to 8. It's fluid.
It's very, you know, it depends how you feel. 4, 5, another 5, and 8 to 10. Very, very big range.
Okay. That's pretty good.
Yeah.
Somebody put 12 to 15.
Some put 12 to 15. We just got another 10 to 12 and then a 5 to 7.
Wow. That's pretty amazing. That's pretty good, people. Let me ask one more question. Of those people, how many of those people really know you? And I mean really you, the real you, not just a little bit of you. Let's see if that number changes any.
Oh, there's so many 2s now. We just got like 6 2s in a row. We got a 1. We got a 2 to 3. You got an 8. That's pretty solid.
That is
Yeah.
good.
And then a couple more 2s. 2 seems like it's the 3, 5, about half of the original number. So it's never this. It doesn't seem like the same amount. Usually it's a smaller portion.
Okay. Okay. Yes. When we start to look at how many people that were really like in that, I think I had a picture of somebody, that circle of trust or whatever from, I forget the movie, but that kind of, are those people really in your circle of trust? So those are people that really know you and kind of affect you in some way. And that number keeps dropping. There's studies that talk about this idea of how close personal relationships have changed over the years. And many years ago, the average for Americans or for people they did in the study was about 5. And that has over time slowly dropped. And there's, we'll talk a little bit about the reasons for that, but I think you guys get what some of those reasons are. We're certainly a little bit more, we're not living the way we used to live, 50 years ago. So having close personal connections, we're much more all over the place. So, we move, we travel, and having more connections or having less connections just seems to be kind of a natural response to that in the way we live. So let's talk a little bit about loneliness right off the bat. It's just feeling sad and unhappy about being socially isolated, right? Well, not so much. Loneliness is much more than that. Loneliness emphasizes the fact, and you can read this, social species require not simply the presence of others, but also the presence of significant others whom they can trust, give them goals in life, work with them, interact, plan, survive, prosper. It's not just having folks around us, but our connection with those people. And, and this can be, it doesn't have to necessarily be a spouse or partner. It can be any other significant person in our lives. And accordingly, one can be, and we'll talk a little bit about this later, but one can be temporarily alone and not feel lonely at all. So loneliness, therefore, is this idea or perception of being alone. So here's some, I just want to give you some, so I'm going to give you some facts and stats and stuff during this, and I want to be very clear. This is all stuff prior to the pandemic. There's tons of studies on this. There's more studies on depression and anxiety, less on how loneliness affects us, but there are a bunch of them. Hardly any since the pandemic. Obviously, people have been a little busy. There's not been a lot of studies. So after we come out of this, I have a feeling we're going to find out a whole lot more about ourselves. Becky and I believe, I can't remember who was talking about earlier, but this idea of, all the kind of keywords that we've had to live with during the beginning or during a pandemic, things like social isolation, social distancing, quarantining, wearing masks, just wearing a mask. All of these things have affected us. And at this point in time, I'm not 100% sure we know how it's really affected us. So what is the difference between alone and loneliness? It's pretty big. And in fact, alone can be actually good for you, right? So what are some ways, and then this is the first question for everybody, if you just put it in the chat box, what are some ways being alone can be good for you? So Travis, help me out.
All right. So we've got peace and quiet, reflection of self, time to reflect, time to pray. It helps with self-care, another time to reflect and self-time. An opportunity to meditate, prayer, and then just an overall reset, plus more self-care. So it seems like there's a lot of themes along meditation, self-care,
yeah,
praying and meditation, just a calm not having things going on.
I'm just curious, and this wasn't a question I wrote down, but do people actually, are there people who just like to be alone? Are there people who like, enjoy? I mean, I know other than just, taking that time for meditation, prayer, self-care, we have people who just like to be alone. It's not, they don't want to be around a bunch of people. And I talk about introverts later, which I'm not sure that that's what they qualify as, but are there people who just like it? Because I could tell you from my own personal experience again, and especially when I was younger, I struggled with this concept of being alone. It was not something I was very comfortable with. I liked being around other people all the time. I liked having people around me. I don't know that I was happy because of that. And the whole point of this slideshow is about this, but there were times when I felt very bad about being alone. I have come to really appreciate alone time. So.
Yeah, there's a lot of agreement in the chat that some people just really enjoy being alone. I usually like being alone for a large amount of time. It's just a way to kind of recharge your batteries and just be still.
Yeah. Look, I think it's, we all are a little different on this, but I do think I want to make sure that I am very clear that alone and loneliness are two different things. And even we talked about even living in social isolation does not by itself create significant psychological stress, as long as, and this is the important thing and the big difference between alone and loneliness, is that we continue to have connections. And we'll talk more about this idea when we get into Johann Hari's work later, but this concept of connectedness. You don't have to be present, and we'll talk a little bit about the studies of what that means here in a minute, but you don't have to be present to feel connected. So why does this all matter? Being alone doesn't kill you, does it? No, but loneliness does. And here's, one of the first studies. It talks about, this is back in 2010. So you can imagine, again, this is way pre-pandemic. They did a meta-analysis, multiple, means they brought together a bunch of studies and it looked at the effects of loneliness and revealed that. And I'm going to come back to this statement in a couple minutes, but the odds ratio for increased mortality for loneliness is 1.45, which is approximately double the odds ratio for increased mortality for obesity and quadruple for air pollution. We'll get into that a little bit more, but I do want to, I'll come back to this statistic later. You'll see why. And then in a sample, I'm not going to spend a lot of time on stats, but in a sample of 2,100 adults age 50 and over, basically what they found was that loneliness was associated with increased mortality risk over a 6-year period, and that neither behavioral health behaviors, and this is important, nor objective features of social relationships. And that, what they mean by that is whether they were married, whether they were next to people, proximity to family and friends could explain the association between loneliness and mortality. So just having people around you doesn't give you that sense of connectedness. And that was why I asked you that first question. Have you ever felt alone in a crowd, or have you ever felt alone in a relationship? That feeling was that idea of being disconnected in that moment. And that's the big difference, again, between alone, having some alone time, and this idea of loneliness. Just a couple of more stats. And, obviously, I think there's that second stat, the one study, and there's multiple studies. There's tons of studies on people as they get older and their sense of loneliness. I think it's pretty understandable. As we age, we lose more connections with other folks. And, when we get to social media, you'll see where that's some benefit, but in general, these are fairly, you kind of understand where they're coming from on this. So this is the significance. Let's talk about what it does to you. So what does loneliness do to you? Here again, this is why I wanted to reiterate this. If you suffer from loneliness, look, I'm a big boy. So when I read this, I was like, okay, I'm reiterating this in my slideshow. If you suffer from loneliness, you are 1.45, which is the mortality rate, is double the odds ratio for obesity. Let that soak in for a second. Some other effects that we know through studies and other things, if you do any basic looking up of loneliness, you're going to find that people have cognitive decline, weakened immune response. Obviously, there's all kinds of stuff. So here's my thing: is what are other things? And I'm Mimi's doing a thing later, which I've kind of got a little sneak peek of about her health and well-being, which really ties closely into what I'm talking about here today. Are there other physical effects of suffering from loneliness that you can think of? And I can't see the screen, Travis. So if anybody says anything, please jump out there.
Yep. So speech suffers as a result of having no one to talk to. That's one that came up.
I like that. Yes. You're going to find all kinds of things related to it. And these were just a few of the things I threw up, but there are tons of physical effects from loneliness. And again, loneliness is not being alone. I want to reiterate that. You can be alone and be totally fine. Loneliness is that idea that you're not connected to other people. That is a state of mind more than it is a state of being. So
we also had weight loss or weight gain, and then your view of the world narrows.
Okay. Yes. And we'll talk later about how that affects you and, moves us on that depression and anxiety scale. And then it becomes more of a self-fulfilling prophecy on these things because of how loneliness is tied so closely to depression and anxiety. Very, very good people. Very happy with you so far. Psychological threats. So we know it causes depression, or really the symptoms of depression. And we know it causes anxiety, or really the symptoms of anxiety. So what other things, that you can think of? And I'm not sure there's a whole lot because that covers a lot right there. But if you can think of anything, please throw it up there for me. Anything, Travis? Sorry.
Yep. So we've got, this will be for discussion at the end. Do you think there will be more in-depth studies on loneliness for farmers, the LGBTQ community, and underserved at-risk populations?
Yes, but yeah, we can talk about it at the end. But yes, very much so.
And then in response to your previous question, we had a few other ones on here. Again, with the weight loss and weight gain, it might make you reassess your self-worth if you're feeling lonely. And social phobia, which, yeah.
Absolutely, people. Absolutely. These are wonderful things.
And then another one is wondering why I have no friends, questioning personality. So, a lot of introduction of self-doubt and damage to confidence.
Yes. Yeah. And again, it becomes a snowball. I mean, these things, this idea of loneliness becomes a snowball. And then you can, we'll talk a little bit about it later because it's part of the second half of this, but this idea that, if you start throwing things like substance use into this, for instance, think about how that would affect it even more. So the more you become isolated, the more you become separated from others that are important to you, it just becomes, kind of this self-fulfilling prophecy. So yes, thank you very much for that and that feedback. So we didn't really need a fancy study to tell us that loneliness kills, right? We all knew this. So there are tons of studies, and we'll talk a little bit about the numbers at the end, but I don't think I needed that. I don't think any of you all that work with folks or are just going through this together with, as we all are, needed that it not being connected to people is not a good thing. And we knew that. So I don't know, all the numbers are great, and they are doing more and more studies as we speak, and there will be tons of information after we kind of come out of the pandemic. But I can tell you, back to the thing where it says it's not getting better, we send more chocolate. We're going to need a whole lot more chocolate to get through this when we're all said and done. So let's talk about the pandemic for a quick second. Again, not having a lot of statistics about how it's affected us at this point in time. I think we're making some guesses, but we all know we're probably not better off. But there is a paradox to the pandemic, and I do want to talk about that for a second. So what ways has the pandemic made your life better? And these are questions I would like you to answer. So the first one, let's start with the first one. What ways has the pandemic made your life better? Anybody got an answer to that?
Oh, so we did have someone say, three people said increased family time. Oh, a fourth is increased family time, less drama, eating healthier because not eating out as much, more connections with family, a lot of that. And more appreciation for outdoors and family time. People who enjoyed working from home, people who enjoyed no crowds anywhere. I agree with that. Beginning to respect the small things that might have been overlooked. Wow, a lot of closer relationships, outdoors. Found out I'm into gardening. That's really cool, Bipta. That's great. And I'd missed two things from your last question about what loneliness can do. Someone had said potential for abuse, self-harm or other issues, and then suicidal tendencies was the big one that came up.
Yes, and we'll talk about that as well.
Gotcha. But yeah, there's lots of stuff with gardening, lots and lots of people saying they were able to connect better with family, eat healthier, learn to appreciate things and didn't miss some of the crowds.
So for many of us, and I will, again, I'm one of these people as well. I mean, for many of us, the pandemic actually there are parts of our lives that it made life better. And those connections that you're talking about and what people put down about connecting with family, feeling more connected, being with it, that can be a very big, can also be a negative depending on your family. But it is hopefully it's a good one. But it has allowed for many people, for many of us to find, some different value, different level of value in those relationships that we maybe kind of took for granted. For me personally, one of the biggest benefits, and I won't tell him that, but one of the biggest, I tell him. One of the biggest benefits is I've actually spent more time with my 17-year-old than I ever thought I would while he was 17. And if you have a teenager in that age group, you'll know exactly what I mean, because by the time they're 17 and have a car, they're gone. This has allowed me to actually spend what I would consider a lot more quality time and build a relationship with him than, his older brother I didn't have, because by the time he was 16, 17, he was out the door. So that's been a real benefit to me and my son. How many of us just feel different about life? Has life changed, that feeling about life and what that means to you? Has anybody had any new feelings about that?
All right, let's see. Kids became better friends during the pandemic, learned to work in other ways.
Excellent.
More money in my bank account.
I don't know if that's a feeling, but that's certainly a benefit.
It could lead to feelings. A greater appreciation of life.
Oh, absolutely. Yes. Yes. I mean, obviously, I think, again, I'm going to go back to my very first statement about being on that continuum. That idea that I am more depressed than I was before the pandemic is true. Yet at times I have been very grateful. I've had a new gratitude for a lot of things. So this idea that I feel differently, somebody talked, I think some of you were mentioning that how life is better is that, I absolutely have that mixed in with a lot of other things. And that's the last question, what things are not as good? What has changed? Not so much for the better for you.
All right, we had a few more really great better things.
Okay, let me go first because I'd like to hear them first.
So we do have people saying they don't feel as rushed. Mary Beth said we develop new leadership skills. Fewer complications, enjoying little things. Learning how to live each day to its fullest. Yeah, carpe diem. Saying that we don't want to return to the rat race of life. That's a very good point. and then learn to figure out what was missing or what you missed the most from the before time. So in terms of what people actually do miss now, we've got people missing the crowds and missing being out and about.
Okay. Yeah, I think that's been, obviously that disconnection from people has not been a good thing. That disconnection from family, at some level. And, I can speak for me for work. I mean, being disconnected from people at work as well has not been something that's been a positive. I enjoy working where I work, and I enjoy working with the people I work with. And that's not been something that's been good because of the pandemic. So that change in, kind of obviously tech and things help with that, but it's not the same. It is definitely not the same for me. So I don't know if it is for others, but I think some people like it better, but for me, not so much.
Yeah, I know on my end, I have a lot of friends in Baltimore, and that's not so far away geographically, but since COVID, I don't think I've seen any of them in person for about a year or so now, because it is one of those things where COVID has introduced a lot of artificial distance between people.
Yeah, absolutely. And I think, it'll be interesting to see how we come out of that, what changes ultimately are made in our lives because of this. What things are going to actually be permanent because of the pandemic. But we'll see. So it's social media time. I do want to talk about this because it is very important and related to this topic of loneliness. And we'll get into it. I did find out that apparently one of these, Foursquare is not a thing anymore. I don't know. And if any of these other, but this helped me understand social media a little bit. I found on the internet. So I don't know if it will help you. I'm gonna leave it up there for a second because it helped me, because I'm not super, even though I have a child that is very connected, I am not super connected to social media. So this actually was helpful. This was a little bit educational for me. And then I like this quote that I found from, I love Robin Williams, but I like this quote. So I put this up there. Probably some of you or many of you have seen this quote before. So let's talk about, this, the whole social media thing is like, and I put up there, it's like some type of science fiction movie for me. And obviously, depending on how old you are and when you became connected to social media and where you are social media, we have the first generation, I think, is that, and I don't know if this is in here or not, but we have right now one of the first generations that it will have never not known social media, if that makes sense. So obviously, when I was younger, the social media did not exist, and the idea of a smartphone and Facebook and Twitter, not a thing. So we now have the first generation of that, where people who have never experienced not having it is now in front of us. So you can literally order anything, right? Or do it. You don't need, and either you need or you don't need. And I put that in there because I'm not sure some of the stuff I order I need. I can have it delivered. You can call grandma, granddad. You can see them even if they're retired in Florida. This is all science fiction, people. For those of us of a certain age, this did not exist prior to, how long ago has it been? It hasn't been that long ago, 20 years, 30 years. Does anybody know how long it's been since we became disconnected? So what are some other ways we're all connected in this virtual world? What are some things that, are other things that social media has allowed us to we're on the forefront of? And let me give you a hint. One of the things that we deal with here is telehealth. So telehealth is something that's come out of this idea of being connected through all of these apps and smart technology. Are there other things that are coming our way? Does anybody have any thoughts on that?
So we've got Zoom in the chat, which is very fitting.
Right, this is what we're doing today. Right, exactly.
In terms of how long it seems like this has been moving, 30 or 40 years, it
Yeah, I
does
think
seem that it gets faster too, though, like every
yeah.
day.
Oh, yes, it is super fast, people. There's a slide later that talks about how your brain's trying to keep up with all this.
We've got
brain ain't winning.
Another good one. Nobody knows how to go outside and play or climb a tree. Where have those times gone?
Well, you can watch pictures of people going outside to climb trees or videos. Yeah, I mean, here's a good one. How has dating changed?
I met my current girlfriend on Hinge, which is an online dating app.
On what?
It's called Hinge.
Hinge.
Hinge. Yep.
There's not a partner to that of unhinged, is
I
it?
don't know if you want to date someone from Unhinged.
Right.
In terms of other positives, we had Mary Beth saying that she can track her diabetic kids' blood sugars and know immediately about low sugar.
Yes. We'll talk about parenting in a little bit, about how it's changed parenting. Yeah, I mean, video, we're going to talk about, look, their stuff is coming fast at us, and the whole idea of, and the things that are beyond us that are, I mean, my car's smarter than, me most days. So there's just stuff that's just coming at us, and somebody said fast. They are absolutely correct. And it's a little bit, I don't know if it's worrisome, but we'll talk about it. So I do, here's a slide. Social media is not bad, not all bad, right? Depends. It's not all bad, but with the good comes an awful lot of bad with social media. And then fake news, bombardment of advertisement, turnover of information. This is that, don't blink, something new is coming, right? Somebody mentioned this is super fast. And these are all dangerous to us at some level. Computer systems that are designed to compete for our brain, and our brains are losing. This weaponization of social media and cyberbullying, stress from scammers, the use of social media as a platform for everybody's immediate opinion, and then trying to decide what's real and is not real has become overwhelming. This idea, look, I don't know about you all, but I have my mom, who I worry about being scammed all the time. I worry about my child and whether or not he's behaving on social media, and whether he's either being bullied or bullying somebody. It's a lot for us to kind of keep an eye on. And also this idea, I think the big one here for me is really that idea that the computer systems that are designed to compete for our brain or for our attention, they're good. These computer systems are really, 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 really good. I know we all have often thought they're watching us somehow, because, if you look at anything if I pick my phone up right now and look at anything, 10 minutes later, I'm going to get something, some advertisement talking about that. So obviously the systems, this idea of social media and the systems behind that are very complex and probably faster, stronger, better than our brains. Anybody have any thoughts on it? I don't want to go past anything, Travis. So if anybody threw anything out there, please let me know.
Oh, so much. It's a very active chat. Your presentation has been quite engaging. So we have some stuff
Well, that's
here.
why I put social media in there. Everybody loves to talk about social media. So I just,
Well, in terms of concerns, we had a comment here. I'm concerned that my kids will say or post something which will later haunt them.
Oh, absolutely. If you're a parent, and we're going to talk a little bit about, absolutely, this is one of the, I'm stressed about that because we hear about this all the time. And as a parent, I'm very concerned that, and look, again, I'm glad that I've got to build some quality time with my 17-year-old, but he can be a knucklehead. So I'm very concerned about that thing that he has in his hand 93% of his time that could actually create problems for him later in life or right now. So yes, whoever said that, I'm with you. Absolutely.
We've got some other ones. There's the quintessential, if you read it on Facebook, it must be true conundrum, where a lot of misinformation is being spread. Also had some family arguments from political truths, falsehoods in on the social media platform. So a lot of different conflict that, and I just as a from the public affairs standpoint, some of the messages that we've received, both public comments and private messages on our social media as the health department, have just been stunning occasionally, and how nasty they are. And you would think that, pretty tight knit community. I doubt the person would say that to any of us if we bumped into each other at the grocery store. But something about social media, I think, adds some strange distance, and people feel anonymous even when their faces and names are right there.
Oh, it's not even social media. I mean, well, I don't know if you count. Well, I guess you do. Email. I mean, email drives me crazy. And that's not even, I'm not even getting into the crux of what you're talking about, because I absolutely relate to what you're saying. Is you almost, it's trapping us at some level. And we'll get I'll throw social media back under the bus later a couple of times. We all we'll talk about a little bit of the positives, but I will throw it back under the bus. But email, I mean, just the concept of email and not picking up the phone or not seeing someone in person, that you miss a lot of stuff in just email sometimes, and what that means or what that meant when they said it. So it is, I agree with everything people were saying. Is very difficult. I didn't want to turn it into a bash session of social media. It's just way too easy to do. But yes, I agree with all of those things. And so yes, certain times of family interactions, I just don't talk anymore. It's probably for the best.
We had a very insightful comment from Summer saying that's why she always uses emojis. Emojis show emotion.
Oh, I like that. That's a good use of emojis. I wish I knew how to use an emoji. Summer's going to have to teach me stuff.
It is, but there's also the danger there if you put the wrong emoji. Like sometimes I thought I was clicking a smiling one. It's actually like a confused face. It's just very. You
have to interpret the emoji.
Exactly. It's a whole nother layer, a rabbit hole to fall down.
Yes. All right. So we all know these. I mean, these are all things that, again, just it's been interesting. It's like I'm in the Jetsons. So what about the kids? Let me just say, first of all, because I broke this up a little bit I didn't want to go into too much, but kids are a whole different presentation, and the kids on social media is a whole different presentation, and it's a different thing. But I did want to put a few things out there, and I talked about this earlier. This generation of youth currently will spend over 5 years of their lives on social media, gaming, not talking to their friends in person. And by the way, some of you will as well. And remember the good old days when parents thought gangster rap and Dee Snider, and I don't know if I'm going to go right over a lot of people's heads with this, would ruin their children's lives with music. My kid shared a video with me the other day from a Mexican drug cartel's Twitter account. Times have changed. So, and I want to just say this. If you do a brief search of the internet on disconnected kids and social media, you will find over 4.5 million articles on that topic alone. That was pre-pandemic, people. So, think about that. And then one theme that just keeps coming up and up and up in those things is that this idea that the more a youth is connected through social media, the more likely they are to become disconnected. So this is something we need to really keep an eye on, because it's almost, the theme with almost all these studies keeps coming up. And if you don't believe that that the Mexican drug cartels have a Twitter account, this is from El Chapo's son, from his Twitter account. This is his Ferrari with a gold-plated AK. So yeah, if you aren't paying attention, this is what's out there. And it's a lot more than that. And obviously you all know the dangers, but I found this interesting when my kid wanted to show me the Ferrari with the gold-plated AK from El Chapo's son. So what are, we could bash social media and kind of what it does there. There are some positives, even for kids, with social media and the whole idea of gaming for kids. What can you name some positives? Let's do some positives first, and then we'll do the negatives. What are some positives of social media and gaming for children or for kids? Does anybody want to take a shot at that?
We have hand-eye coordination for gaming.
I like that. I don't know who said that, but you cracked me up.
That was Christy. And you know what? I agree, especially as we get more VR stuff, like getting good at stuff.
VR is scary.
We've got allowing people to express themselves. We have gaming has inspired my son to study more statistics related to sports. I think that's kind of cool.
Excellent.
Summer says if they're playing Fortnite, they can gain leadership skills. Summer, I don't know if you've ever played Fortnite, but as someone who's played Fortnite, there's very little leadership. It's more of chaos. But maybe some of them are doing it right. Let's see, typing skills. We have my daughter learned how to cook using YouTube. YouTube has just been the best.
Yep. Excellent.
Yeah, another one for typing skills. Lots of engagement on this. I'll say, as someone who's been playing video games my whole life, when I was a kid, I learned a lot of different words and bits of history from video games. Like I think would be surprised the way that interaction can stay with you. It always kind of helped my vocabulary because you'd see all these terms pop up that you wouldn't. And some games have a lot of history built into them. We also have learning how to focus.
Yep.
Oh, and we've from Trudy, Worcester Rec and Parks is having a Fortnite league. Okay, that's pretty cool. So Eric, you can start a team and work on those leadership skills as expressed through the video game Fortnite.
Yeah, I mean, look, there's a lot of, I think there's a lot of positives to social media. Gaming, I'll give you a couple gaming ones for me, I think that are important to kind of recognize. One, my kids are very, very athletic. Both my children were extremely athletic and got a lot of positives out of sports. Not every kid's athletic. Not every kid gets positives from that. Going out, they're not going to go out and be the captain of the baseball team. So a lot of kids can find other positives from being able to be good at gaming through gaming. So I've had a lot of parents talk to me about that. I also will say this and I'm gonna go back in my history here for a second. This is for those of us who were in my business, which is working with families and children and folks in behavioral health. Sometimes it's better for kids to be gaming than doing the other things they could be doing. So I've seen some positives in that. But I do agree that there's probably a lot of scary negatives. So let's talk a little bit about that. And then I'm going to move away from kids. Well, no, I'm going to go to parenting real quick, and then we're going to move away from this because I don't know. You all are going to keep an eye on my time, right? Because, we can talk all day about some of this stuff. So what are some negatives of social media and gaming for kids? Travis?
I'm waiting. I'm apparently, I don't know. No, there's, all right. Eye strain. So the physical side of it. Well, and on top of that, carpal tunnel. Carpal tunnel
and eye strain.
Bullying, I guess specifically cyberbullying.
Cyberbullying, exposure to kind of some crazy stuff out there.
Yep. Time consuming. I can attest to that. I can exposure to bad language and violence when they're younger, lack of physical activity.
Yes. Yep. That wasn't Mimi, was it?
No, that one was that was Josh. Thank you, Josh.
Thank you, Josh. You're absolutely correct.
So it might impact how they're able to socialize with others. I mean, if your primary method of socialization is Xbox Live, then it might be difficult to
no, and let me expand on that. Again, this is I said about this with kids being this is a whole nother, we can do a whole day on this. Here's what I'm going to say to that. One of the things is this idea of emotional monitoring when kids are gaming alone versus if you were to game with other people near you. There's a lack of emotional monitoring that goes along with that. That can be a real negative for kids. So the idea, and if you want to know what I'm talking about, stand outside your kid's room while they're playing a video game and wait for them to scream at their television. That's what I mean by that. So that certainly is a challenge with one of the negatives.
All right, we've got quite a few more. Social media. This is from Lynn. When parents aren't watching what their kids are doing, they post pictures online. The kids don't understand that those pictures are forever.
Yes, yeah, social media. Yes, yes,
From Mary Beth, trying to help children achieve the balance between those things and real life interaction. So again, time management and finding balance.
yes, absolutely. Fantastic. Very, very good.
Oh,
Very
some of the concerns about people who might be hacking, or also, I guess you could pretending to be younger and then interacting with kids. I know with
predatory stuff. Yeah.
platforms like TikTok that has a much younger user base, that definitely seems like there's some current concerns about people accessing that who aren't also children, but then getting all these pictures and videos of children. Catfishing.
Yeah, absolutely. Yeah, all this stuff is very, very good. Thank you very much. Let's move on because they're going to cut me short soon. What are you laughing about?
No, you're doing great. Well, we've got you scheduled for, so right now it's 11:09. We have you scheduled to 11 for the initial presentation, but 11:15 for the Q&A. You've kind of been doing.
I'm going to go much faster then from here on out. People.
All right.
All right. Sorry.
I'll let you go.
Travis. All right. So let me just a couple things, and I won't ask you to respond because I'm way behind. Sorry. But I do want you to see this. If you're a parent of a teen that has a driver's license and a car, do you know how fast they drove their car yesterday? And I guarantee you a bunch of you do know that. How many of you have texted your child from another room in the house? And, you know, I don't want to, you can put it in there, but what other ways of parenting change? And I'm going to go on, but if you put it in there, so yes, and I bet you a bunch of people have found other ways. And then I'm gonna skip this social media. We know we've talked about what the benefits of social media for adults and some of the pitfalls. They're similar to kids but different. So hopefully there's less. Although I do want to say this. I'm not sure there's truth in advertising sometimes with us adults. So I'll skip on by that, but because I want to get to this, which is the why. So, because now I'm going to come back to, well, you're going to like, Eric, what did any of that have to do with being alone and loneliness? So let's talk about the why of loneliness. And you get the whole point of that whole social media piece of this talk is it's a huge part of our lives, And what I'm going to say to you about it is, how is it allowing us to be connected or disconnected? And we're gonna get into that a little bit, but think about that. And again, I apologize. It's probably we'll have to, maybe we can set up a time when we do a whole, if everybody's interested, a whole kind of half day or day training on this. So let's talk about the whys. And we know there are some causes of people to become isolated and possibly suffer from loneliness straight out of the box. Losing a spouse or significant other, boom, puts you at risk of that. And I think everybody understands that. Being a caregiver for somebody, retirement or major social change, and obviously a pandemic. We know that immediately could put you into a situation where we're suffering from loneliness. So let's go back to my first slide. Why is all social media's fault? Right now, probably not. But I do want to make sure it's a thread that goes throughout when we discuss the why. And then I want to just make a disclaimer, which I said earlier, introversion does not equal loneliness. There are people who are perfectly fine not being connected to everybody all the time. I am not one of those people. I am the opposite of that. But I would say I just want to make sure that we don't, try to rush all of our introverts into therapy. So I'm going to talk a lot. The rest of this is all really kind of some of the work that Johan Hari has done. And here's his book called Lost Connections. Thank you, Jennifer LeMaid. Read the book. It's awesome. And I highly recommend folks take a look at it when they get a chance. And then this is a quote from Johan Hari. What if depression is in fact a form of grief for our own lives and not being as they should? What if it's a form of grief for the connections that we've lost and yet still need? And so I'm going to go on since I got like 7 minutes or 3 minutes or whatever it was. Multiple views. And this is my disclaimer. If you want to know, read the studies, talk to the experts. And if you work with folks with disorders, please get smarter about your work. And the information key here is becoming more successful in treatment. So information is the key. So let's talk about the book. I'm not going to talk about the book here, but all he wanted to do with this book was talk about the why of depression. And what I want to say here is that this struck me as a professional. And I have to say, in my career, I've worked with a lot of folks who have depression, and we often consider this a brain chemistry issue. And this book and what Johan talks about is really how, yes, there is that connection, but there's so much more to it. And what he came up with was this idea of 9 factors causing depression. And what he said was, we are now finding ourselves in a place where we recognize that these 9 things all contribute to us being more depressed and more anxious. So just a few quick things. I'm going to go through each one of the 9, and then we'll knock it out. So how many hours do we spend at work? And I'm going to bet, you guys can throw it up there real quick, but let's just say, and don't think about how much you spend at work, but also how much time you spend getting to work, going home from work, thinking about work, all of those things after, in a week. And I can tell you, for me, it's, I don't know, it depends on the week, but it's way past 40 hours. And then think about this. What if you work in an environment where you have little to no autonomy or lack a sense of purpose in that job? How do you think that job would make you feel? And Johan goes into a whole, this explanation of what that does to us. But you get it, right? So if your job is coming in every day, and he talks about this in the book, but if your job is a job where you don't have any sense of autonomy or any sense of purpose in that job, you're going to be more depressed. And he talks about, and I missed part of the slide earlier, but what the book is about is the studies related to these facts. And the fact is that they've done lots of studies about, if you feel disconnected to your job or your work, you will feel more depressed and anxious. And he gives this idea of, if, he talks about this guy, this one particular case I kind of highlight, which is where the gentleman comes in every day and he mixes paint for a living. He works at a paint store, and his whole job is to mix paint. And he just can't figure out why he feels depressed all the time. And he talks to his therapist and really starts to understand that there's no purpose in his job. And every day he goes to work, he feels worse when he gets to work because of that. So finding purpose, finding autonomy in our work is very, very important. Disconnection from people. And here's a great question for all of us. How many of your neighbors' last names do you know? And this I do want you to answer for me. So do you know a bunch? Let's do a few or a bunch. Just respond a few or a bunch for me.
We already got 1 0. Another a 0. Wow, a couple zeros. A none, a few, a bunch, 0. Wow.
Right.
But here we got a few more bunches. So very wide array of different. And also, Eric, you're on a great roll. We're gonna go ahead and allot you more time since you're doing so wonderful. So if you could go till 11:30.
Sure, that's going to be easy.
All right. We got a couple more people saying 2 to 3, a bunch.
Okay. So you get why this is important. I mean, look, if you're disconnected from your people, your environment, and I put environmental. This is the environmental context of this disconnection. Is if you don't know who your neighbors are and you're disconnected from them, what Johan would say and what the studies say is you have a higher likelihood of being more depressed. Just that disconnection. And here's the real question: is screen-mediated technology, which is a fancy word for what we're doing right now, really giving us a connection? And I don't know if I know that answer, and I think they're still working on that. Here's an important thing I want to say to anybody who works with folks who suffer from substance use disorder, addicts. Make sure you have it. And this is something I've said, we when we talk to people with addiction, we tell them, oh, you got to change your persons, places, and things, right? What do we tell them to replace it with? Make sure you're telling them what to replace it with. This is extremely important. And are you connected? We are connected to millions of people, but are we missing that one thing that we really need? And again, that's connection. So you live next to a bunch of people and we don't know who they are. That's the people we live next to. How does that affect us? Well, here's the question. If I say fish heads, this is called disconnection from meaningful value. So this is another chapter in the book, but again, one of the 9 causes. If I say fish heads, what does that mean to you? Does anybody want to put that in there? This will only apply to a certain group of people on this Zoom.
We have someone saying no brains. Sneakers.
Huh? What was that?
Sneakers?
Sneakers. Yes. Thank you. Thank you, people.
Fishermen, shoes, the leftover carcass.
Shoes. All right. Let me explain this real quick for those of you not of my age. When I went to school, high school, if I wore fish heads to school, I would have been made fun of because these were shoes that did not have a name brand on them. I actually started school prior to things that had name brands, but later in life when I was in high school, if you wore shoes that were not Nikes, Adidas, Puma, which were the only 3 shoes I think at the time, they were called fish heads and you would be tortured for wearing them. I threw that out there just for fun, but the idea of disconnection from meaningful values. So us as a society focusing on this idea of materialism and doing things purely for extrinsic rewards instead of intrinsic reward. We've all said that things don't make us happy, but do we actually believe that? And Hari points out that the pursuit of these things actually makes us depressed and anxious. So the idea that we try to pursue things that are materialistic or extrinsic actually affect us in a negative way. And what do you see on social media? What do people put out there? Do they put out there how they're not doing good? Or do they put out there this idea that it's this, everybody's doing great and I must be doing great too. And if I'm not doing great, what am I doing? And that's what I'm talking about. And that's what Hari's talking about here. Here's something that will just, and look, we know that that you're going to be disconnected. And this is my business, obviously, but I just want to throw out a couple things real quick. Traumatic experiences. Obviously, if you have traumatic experiences in your childhood, you're going to have potentially much more significant increase in the likelihood that you'll be diagnosed with depression later. And just the thing about suicide and loneliness, if you suffer, we talk about ACEs. That's the adverse childhood experiences. And there's a scale for this. So I just want to throw those things out there and I'll move on past it. But we all know this. And this is something we know. And again, we could do a whole day about this. Disconnection from respect, which is this whole idea of status, this idea of being connected by status, celebrity, and wealth, and what denotes this success. Anxiety over the loss of financial security and status often are underlying constant stressors in people's lives. I don't want anybody to raise their hand, but I bet a lot of hands would go up if people knew, it would agree that if you suffer from this idea of loss of financial security and wealth and things of that nature, you're going to suffer from this. And I do want to mention a gentleman named Robert Sapolsky, who's a scientist who actually studied baboons. And he was able to by the way, he's a super genius and he's a professor at Stanford. And if you ever get a chance to look him up. You get to go to Stanford for free on YouTube. That is one of the benefits of social media. But he basically came up with the idea that, being king, and I put King Louis in there, is great. If you are king, life is good. The only time being a king is when it's not good is when you're challenged. And Robert Sapolsky talked about that in his studies. And Hari uses it as kind of a representation of us in that, being king's good. But being worried over security and status is not so good. And as long as you're king, great. But when you're challenged for that, or when it seems to be falling apart, you're going to be disconnected and often feel more potentially depressed and anxious. Disconnection from the natural world. This is again, are we connected? And Mimi's going to talk about this later. And I actually put down there, this is rates of depression when exercising in the natural world and spending time outdoors all reduce in comparison to time spent inside. Somebody said this earlier about getting kids outside, but we also need to get outside. We often feel more alive when outdoors and in nature, and or as I like to say, we feel more mimied. This is what Mimi will tell us about later, and she's absolutely 100% right. The more we're outside, the more we're experiencing nature, the better off we are mentally, and with our depression and our anxiety go down. So biology, this is what we often think about when we talk about depression, is because my brain's just messed up, right? Well, not so much all the time. And I'll go back to that real quick, but we talk about neuroplasticity and this idea that the brain is broken, but reality is that the brain can fix itself in many ways. So to say somebody's brain is broken is not necessarily a good way of looking at depression or anxiety, because the brain actually changes over time. Our brain moves and it adapts. And these changes can, kind of help us in both ways. They can either sometimes make us more depressed or sometimes help us be less depressed and anxious. And then genes. I'm depressed because my mom's depressed. Well, maybe. National Institutes of Health say that approximately 37% of depression can be attributed to inherited genes. And that's just one study that I was looking at. There's a bunch of other ones. And then there's this gene 5-HTT, which they've done a lot of studies on. It says that if you have this gene, you are more likely to become depressed, but only if you suffer some type of traumatic event or childhood trauma. So 37% of depression can be attributed to genetics. A percentage of that can be attributed to kind of biology. So where's the rest of it coming from? It's coming from the fact that we have this disconnected world, that we are often suffering from a disconnection from people, and loneliness has an effect on us. This is so biology, genes, only a small part of the picture. And I think you all understand this and get it. So a pill will not get us out of this mess. Understanding the whys, the first steps in moving ourselves out of the scale, the scale I was talking about earlier, and embracing this idea, this concept of which we say we do, this biopsychosocial model of treatment, this everything counts. So when you talk to somebody about depression and anxiety and you say to them, well, go see somebody, maybe they can give you an antidepressant. That's great. But make sure you ask them, why are they depressed? Why are they depressed? We don't do that enough. And I think if anything out of Hari's writings, we should learn that lesson. So I ran through some of the stuff at the end, and I apologize because I was just having way too much fun with social media. And lastly, what I want to leave you with is this. If you want to make somebody feel better, just smile at them. It immediately raises their oxytocin levels. But that's another presentation. So thank you guys. I really appreciate your time. I hope if there's any questions, we probably have zero time. Summer came and just scared me at my window. So thank you. All yours, Travis.
All right, Eric, that is perfect. I'm almost a little disappointed, honestly, that you did in fact finish speaking on time, because I had a YouTube video for the song Closing Time queued up, and I had it set right to the moment where they say closing time. You don't have to go home, but you can't stay here.
Thanks, Travis.
And unfortunately, you did ruin my ability to do that. So that's fine. It's not a big deal. Don't worry about it. But it was a really great presentation. Thank you to everyone who posted questions. That was just so engaged. So many different people jumping in. So I'm going to, again, hand this off to the lovely Becky Jones to present the award for 2021. So Ms. Jones, you can go ahead and take it away, and I will spotlight you.
Hello, everyone. Again, Eric, thank you so much for the presentation, and everyone that was engaged in the chat box. Those were some great questions and some great dialogue. So we're moving on, and we are at the next part of our agenda, which is for the 2021 Debbie Geller Excellence in Public Health Award. So it's my pleasure once again to present another Debbie Geller Excellence in Public Health Award. As I said, this one is for this year, 2021. I know we've talked about Debbie a lot, but some of you may not know Debbie was our health officer, trusted leader, and I can personally attest to a great friend for over 25 years. Her vision for public health, what she accomplished over her years of service, continues to shape the future of our organization. And as many staff know, I keep several pictures of Debbie here in my office, just as a remembrance of her and the amazing leader that she was. As we've said time and time again, last March, our world changed for all of us as we began our efforts to understand and address this novel coronavirus, as we now know, COVID-19. At the health department, we prepare and practice endlessly for emergencies that may affect our community. In doing so, because of these plans, we stood up our incident command structure and immediately began working with our local partners to address the virus and slow the spread. This journey of working to protect the health of our citizens has been both challenging, but more importantly, very rewarding. As I spoke of earlier, in addition to our ICS, we began our call center, which, every day during business hours, was responding to all kinds of questions from our community. And the pendulum did swing, I can tell you that. Early on from some of our calls, everybody wanted everything closed down. The other half, it was open everything up, and a lot of passion on both sides. And our staff were just amazing in their ability to, toe the line, stay with those callers, tremendous work ethic, and getting them the answers that they need. As I spoke of before, we began offering drive-through testing clinics, and now we're very busy with our weekly vaccine clinics. We've learned to provide critical services through telehealth modalities, as I spoke of earlier, and we continue to serve our jurisdiction safely and effectively. You're going to be seeing some pictures shortly in a video montage that we've put together over this past year. And as you will see from those pictures in the services that we've been providing at the front line, was through all types of weather. Whether it was 130 degrees when you're in full PPE in the middle of summer, providing testing, to fast forwarding a couple of months when it's 30 degrees out and it's freezing cold and you're providing vaccines in a drive-through setting. Just an absolutely amazing and dedicated workforce. I celebrate all these milestones with all of you, our entire community. And I know you'll join me in applauding the effort of our heroes of public health. As health officer, I never once doubted the resiliency and flexibility and the absolute dedication that our staff possess. Our staff have demonstrated a great and amazing teamwork and endurance. With that being said, I'm very pleased to present the Debbie Geller Excellence in Public Health Award to the entire staff of the health department. Each staff member is an essential piece of the puzzle of our agency. And I'm awarding each staff with a pin that says, "You are an essential piece because you are." I hope you can see the pin. Hope you can see it okay. I am proud and thankful for their support. Together we have accomplished so much, and I am honored to work alongside each and every one of you. I know Debbie Geller, DG as I would always call her, would be as proud as I am, and honored to have an award in her name go to staff. So can you please join me in giving all of our staff a virtual standing ovation for a job well done? And you can put clappy emojis in the chat box if you'd like. While we've come a long way and there's much to be positive about in terms of vaccines and decreasing positivity rates, we still have a ways to go, but we're going to get there together. And I can't leave here without saying, you know, everything we learned in kindergarten, right? Including basic public health strategies of saying, and all, you know, staff, I'm sure are getting ready to type this in the chat box because they're going to say it with me. Wash your hands, wash your hands, wash your hands. So thank you, everyone. And I hope you enjoy the video. Travis, I'm going to turn it over to you.
All right. And I'm immediately turning it over to Summer because she's got the video queued up. So Summer, go ahead. All right. Thank you, Becky, for presenting another award. You should probably be a professional award presenter at this point. I think you did a great job. Congratulations to everyone who was part of that. And a huge shout out to, first of all, my headphones for messing up my hair, but also all of my wonderful coworkers at the Worcester County Health Department, everyone involved in public health. This has been just the wildest possible year. But seeing the response from all the different departments, everyone working with the clinics, the call center, ICS planning, it's just been fantastic and really affirmed that everyone here is wonderful. They're dedicated and they're professional. I'm going to turn over now to Summer, who is going to do a introduction for our last presentation. We've been running really smoothly. We're coming up towards the end, so we're going to go ahead and skip the break. If anyone needs to sneak away to use the bathroom or grab some popcorn or whatever you want to do, we are on Zoom, so it is convenient. Hopefully everyone is watching this at home in their pajamas, so feel free to dip out and come back. But we're going to go ahead and run into our last presentation. So Summer, go ahead and take it away.
Thank you, Travis, and I am honored to get to introduce Mimi Dean. Mimi earned a Master of Science in Clinical Exercise Physiology from East Stroudsburg University and a Bachelor of Science in Exercise and Sports Science from Penn State University. Mimi has been certified by the American College of Sports Medicine as a clinical exercise physiologist since 1997 and received the Level 3 Exercises Medicine credential in 2016. She is the Director of Prevention Services here at the Worcester County Health Department. She has over 25 years of experience in the fitness and health industry with experience in worksite wellness, personal training, coaching, fitness instruction, clinical exercise physiology, cardiovascular and pulmonary rehabilitation, public health, and higher education. Physical activity is her passion, and helping others to be physically active is her life's work. So please help me welcome Mimi Dean.
Earlier, we heard from Eric about the effects of isolation and loneliness that has impacted many of us during this pandemic. This has certainly been a challenging year, full of twists and turns and events that none of us saw coming. The reduction in human interaction has impacted us both mentally and physically. Stress and worry about our health and the future has caused some of us to engage in less than healthy behaviors, eating more than we normally do, exercising less than we used to, and generally feeling less energetic. I'm here today, though, to talk with you about things we can do to combat this stress and cope with all these disruptions we've had to our daily lives. I have 3 really important words for you. Exercise is medicine. That's right. It's a medicine that we should take each and every day. Young and old alike can benefit from participating in regular physical activity. Regular exercise helps to keep us healthy. Now, when I was around 14 years old, I was tragically shy. I think this stems back to my childhood. I was born 2 months early, and at that time, a long time ago, the premature babies were kept in the hospital and pretty much isolated. The trauma of my birth, coupled with the isolation endured during my first few months of life, affected and impacted my growth and development, not just physically, but also emotionally. I was a very shy child who, if possible, became an even more shy adolescent. One day, when I was around 14, I decided to emulate my father. He was my idol. And I tried to start running. He was a great runner. And I just put one foot in front of the other, and I told myself, just keep moving forward. It was really tough at first, but over time I noticed it became a little easier. As it became easier and I could run further, I noticed changes in myself. My shoulders started to go back and my head started to lift up, and I was making eye contact with people and engaging in conversation. Unbelievable. The confidence that running provided for me changed my life. I went on to college and when trying to figure out what I wanted to do with my life, I remembered that great feeling I got from running. And now I wanted to share that with everyone. I majored in exercise science and have spent the past 25 years helping people become and stay physically active. Throughout this life's journey, during the greatest periods of loss and loneliness in my life, I ran. And it was my companion and my strength. I'm not saying you have to become a runner. Simply find that form of physical activity that you enjoy and can make part of your life for the rest of your life. What kind of activity should we do? How do we get started? If you have not been active, you really want to talk with your doctor or healthcare provider before starting any new vigorous exercise program. The main goal, though, find something you enjoy and you can incorporate into your daily life. For many people, walking is a great form of exercise to start with. Start with short sessions, 5 to 10 minutes. Gradually, over time, increase the duration to 20 to 60 minutes. Now, I know that sounds a lot right now, But ideally, we want to try to engage in aerobic exercise or activity like walking, biking, dancing, swimming, 30 minutes per day, at least 5 times per week. Participating in this activity at moderate intensity. What does that mean? Well, how hard do we have to work for it to actually benefit us? I use something called the talk test. If you were able to talk while you were being active, that's a good pace. If you can sing, then you need to pick it up. If you are gasping for air, slow down. Over time, you're going to notice that you're able to perform the activity at a slightly faster pace and will still be able to talk. Pretty cool. In addition to doing this aerobic activity, we want to try to add in some strength training, build our muscles. There are many benefits to adding in this form of exercise. Building muscle strength and endurance helps reduce body fat and increase bone strength. We want to try to aim for participating in muscle building exercises at least 2 days per week. So 2 to 3 days per week, selecting a weight or resistance that you can lift 10 to 15 times. You're going to aim for 2 to 3 sets of each exercise, assuring that you're working all the major muscle groups. You can select from a variety of modes of strength training. You could use resistance bands, you could use free weights, you can use weight machines, your own body weight, bottled water, soup cans, laundry baskets. We want you to try to progressively overload your muscles to make them stronger. What does that mean? Start out doing sets of 10 repetitions, and as you get stronger, do 12, and then 15. Once you can do 2 to 3 sets of 15 repetitions, and it isn't that hard anymore, you can increase the amount of resistance you're using, and then drop back down to 10 repetitions, and continue to build. Now, another component of a well-balanced activity plan that we want you to engage in is flexibility exercises. Sometimes we forget about these, but we want to do stretching after we do our aerobic exercise. So after you walk or you run or whatever, you want to aim for 5 days per week. And you want to try to hold your stretch at a point of mild tension, not pain. Don't bounce, hold it 10 to 30 seconds, repeating it 2 to 3 times. Now, some additional strategies for helping to cope with stress during this time include relaxation techniques, limiting our intake of caffeine, nicotine, and alcohol, as all increase our stress response. Remember what we can and can't control. At this point now, we're going to do some visualization.
Now, as we start our visualization exercise, relax. Close your eyes. Let your worries and thoughts drift away. You are breathing slowly in and out. Relax. You're going to use your ability to visualize, to daydream, to make a picture in your mind's eye. Let your worries and thoughts drift away. Your imagination will be clearest when your mind is free of thought and worries. If distracting thoughts or doubts about this process come into your mind, let them float away like small clouds in this blue sky. Relax. You are breathing in slowly and out. Relax. Imagine yourself in your most favorite place, a calm place, a quiet place. Take a deep breath. Imagine the beautiful clear air, or the warmth of the sunlight, or a cool breeze. Think about what it looks like in your most favorite place. Can you see it? Imagine yourself sitting down and breathing deeply in and out. So calm and so peaceful. What do you hear in your most favorite place? Perhaps you can hear birds or waves against the sand. Think about what you hear in your most favorite place. Take another deep breath. Imagine closing your eyes and just listening, feeling the peacefulness, the restfulness of your most favorite place. Imagine yourself lying down in a comfortable position as you breathe in and out. Listen to the quiet sounds around you. The weather is just perfect. As you relax and breathe in and out, your mind is still. If you have any last thoughts or worries, watch them float away like small clouds in this calm blue sky. You are at peace, completely at peace. Continue to breathe in and out, and continue to imagine how you feel in your most favorite place. You feel peace, you feel calm, and you feel joy. Take one more deep breath in and out, and relax. You feel refreshed and ready to bring this relaxed and energized feeling back with you into your everyday life. Take one more deep breath in and out. Slowly open your eyes and stretch.
And now that we have returned back from our most favorite place, I want to share with you some great programs that the Worcester County Health Department has to offer. Just Walk. This is a free, self-directed, self-reported, incentive-based program that rewards participants for being active. You get prizes. View us on justwalkworcester.org to sign up. Worcester Wellness Way. This is an innovative, technology-based approach to addressing child and adult obesity through online education learning modules, coaching, community gardens, and wearable technology. It's a program that was designed with the whole family in mind. Each participant receives a personal physical activity and nutrition coach. It's a partnership between the Worcester County Health Department, the University of Maryland Eastern Shore, Salisbury University, Warwick Community College, the University of Maryland Extension, the Atlantic Club Garden of Hope, Pocomoke Corner Sanctuary, and Chesapeake Healthcare. Healthy Lifestyles. This is a program, it's free as well. It's online or in person, and it's geared to teach participants about healthy eating, physical activity, and stress management, designed specifically for those in recovery. You receive weekly lessons and supports for making healthy lifestyle changes, cookbooks, measuring tools, food containers, and more. What's Cooking in Worcester? This is a monthly cooking show that's featured on the Worcester County Health Department Facebook page. Each month, our staff demonstrates simple, healthy recipes that you can make at home. They're low cost, easy, and delicious. Lifestyle Balance, Diabetes Prevention. This is a year-long healthy eating, physical activity, and weight loss program proven to prevent type 2 diabetes among those who have prediabetes or at risk for developing type 2 diabetes. Participants work with a lifestyle change coach and others who are also making lifestyle changes. The program is offered in person and online. We also offer tobacco cessation. This is taught by a trained cessation instructor and is available for both adults and teens. It's also offered online in person. For additional information about these programs or to enroll, please call 410-632-1100, extension 1108. Thank you, and remember, eat healthy, be active, and prevent diabetes today. Early.
All right, we'll turn it over to Mimi. That was an amazing video. I know you have an activity, so I'm going to go ahead and spotlight you. So whenever you are ready, you have the floor.
Great. Can you hear me?
Yep, we can hear you.
Okay, perfect.
So before we move on to my activity, I did want to just remind everyone, some additional things we can do with coping during this time. Of course, making sure that we're getting enough sleep. Sometimes sleep can evade us in periods of stress, but being active actually can help you with your sleeping patterns. Turning off the blue light for at least an hour before you try to go to bed is also important. Kind of reducing that stimulation. So we're able to sleep better. If we don't sleep, it tends to raise our cortisol levels, which is that stress hormone. So we stay elevated all day long. And it just becomes a perpetual cycle. So again, making sure we're sleeping well, as best as we can, drinking plenty of water, eating a well-balanced diet, and then remembering what we can control. And again, we've said it all day long. What can we control during this pandemic? We can wear a mask. We can wash our hands. Like Becky has said time and time again, we can support one another by staying away from one another, practicing that physical distancing, finding other ways to connect with our friends and our loved ones. And the other thing we can do when it becomes available to us, get vaccinated. Those are the things that can help us return back to our lives. So I want to do something fun because I don't want to leave on any kind of a somber note. We're going to do a little game because I like to get people moving. And some of you previewed this yesterday, so you're not allowed to participate. Just kidding. So we're going to play a scavenger hunt. We're going to do a 1 minute, and hopefully it doesn't take quite a minute for you each to find these items. In your office or at home, wherever you are, we'll have 60 seconds to find the item. And if you find it, I want you to hit that little raised hand, and then hopefully we can see that. I'm not sure if we can or not. And then we will spotlight you so you can show us the item. Okay? And whoever's the first to raise their hand or show us their item is going to get a prize in the mail from the department. Something to help with coping and stress. All right, are we ready? Okay, I want you to find something round. Go. Ah, I see 2 hands raised. 3 hands raised. Okay, anyone know who raised their hand first?
It was close. I think it was Sue Summer. So Sue, Joe, and Mary Beth, and now Bipta. I think Sue, right? Yeah. It was all right. Splitting edge close, but Sue was the first.
All right, Sue, can we see what you got? What do you have that was round? Can you turn your camera on or no?
Well, all right, Sue, I've given you permission to talk if you want to. And I'm not sure if you can turn your camera. I'll promote you to panelist real quick. So if you do have a camera, you can turn it on. Or you can chat. Yeah. Oh, wait, she does. Yeah. Sue's on camera.
Wait, how come I can't see her? Yay.
There she is.
Wait, what is that? My vision's not good.
Yeah, let me see if I can. Here, I'll spotlight her for a second.
That's okay.
Okay. But thank you, Sue.
Yeah, great job, Sue. All right, ready? We know how this game works now, so I want you to find your favorite coffee or tea mug. Go. Oh, that was someone knew it was coming. Who was it first that time?
I didn't see who was first either.
All right. Honesty. Does anyone know who was first? Oh no. Now I see none.
I put the hands back down. They were still up from last time.
Oh, okay. So. Who had their hands up?
Oh, Bipta just went up. All right, Bipta, I'm going to do the same thing and promote you temporarily to panelist if you have a camera or a microphone, or if not, you can just put it in chat. Everyone's quick today.
Oh, I knew, super quick. They knew that it was coming.
Oh, there's Bipta.
All right, great. What does it have on it?
This is a cup that was gifted to me from my friend. It has me and her
Aw,
sitting together. So I
That is
drink coffee from this mug every day.
That is awesome.
that's beautiful.
Awesome. Great. All right. Are we ready for the next one? This one everyone should be able to find. Hopefully. It is hand sanitizer. Go.
Okay.
Who was the first one that time?
It was Jerona Smith. And I'm going to do the same thing and promote you to a panelist if you have a camera or microphone. And if not, just the chat. Very fast. Mary Beth, you were very quick too.
Here it is.
That's like Sentient and stuff, huh?
Yes.
Woo!
Bath and Body Works.
I love it. Awesome. You had it right there. Perfect. All right. Last thing. Are we ready?
Oh, hold on. Is it okay if we spotlight Mary Beth real quick? Just because she has put her hand up for the last three. She's very active.
I'm sorry. Yeah, of course.
All right. So Mary Beth, I'll do the same thing. If you want to hold up your latest find. If you've got a camera, and if not, that is okay. We love the enthusiasm. All right. Well, just wanted to say thank you. And you've been very active.
Oh, there we go.
Oh, yay. All right.
Awesome.
That is fantastic. Thank you, Mary
Is
Beth.
that orange? You have something yellow there. I mean, it's something.
Oh.
Yeah, she's like super prepared for all of this.
Did you see these questions?
There was the orange, and here was the cup
Oh,
with the tea in it.
Yeah, that's perfect.
absolutely ready for everything. Thank you,
All
Mary
right.
Beth.
Are we ready? So last one. Find something yellow. Ooh.
Oh, Sue again. Sue is just on fire. All
Where'd
right.
she go? Is that a sticky note? Perfect. Perfect. I have some too. And a highlighter. But I chose yellow because yellow is actually the color for April. This is Public Health Week is celebrated in April. And I just wanted to leave with one quick thing. As part of Public Health Week, we in the past had our Tortoise and Hare Day, our 5K walk run at Public Land, not Public Landing, at Shad Landing. We can't do that this year, of course. So what we're going to do is a scavenger hunt. I don't know if you all received the flyer. You should have received the flyer promoting the scavenger hunt. So obviously we're at games, but we are hiding some wellness rocks in 3 public parks for you to go out and find this weekend. You just have to count up how many you find, and then you will take a picture of yourself with those rocks, and you would send the picture to crystal.bell1@maryland.gov. Now, the rocks are going to be hidden on Friday, and you can go look for them on Saturday and Sunday of this weekend. They're going to be at Bird Park, Cypress Park, and at Stephen Decatur Park in Berlin. So we have 3 different parks where you can go out and try to find these wellness rocks, and then snap a photo of yourself with those with the rocks. Tell us how many you found, and you can win a prize. The first 50 that turn in their photo will get a nice little item sent to them. Of course, it's going to be helping to promote physical activity and coping during the pandemic. All right, I think that's all I got for you. Have a great and active day.
All right. Thank you, Mimi. That was fantastic. Let me spotlight. So that represents our public health conference for 2021. This was the first year that we went virtual. And it's been a blast. It was a lot of learning along the way on our end. And as the wonderful Becky Jones says, technology is both a blessing and a curse. Different day, different way, and just keep swimming. I have multiple coffee mugs with Becky Jones quotes on them. She might not know, but I guess now she does. So we just want to do a quick closing thank you to all of our panelists thank you to Dr. McGinnis for joining us from outside of the health department, and of course to Eric and Mimi. Thank you, Summer, for co-hosting with me and doing such a fantastic job. And I'm also going to put you on the spot when I'm done, and you're going to have to do a tiny little closing as well. But because we are socially distanced and safe, but in the same office complex, one of us has to mute when the other one's talking. Otherwise, it just turns into like auto tune. So thank you, especially to everyone who attended and stuck with us the entire morning or was here at any point, and those who participated. It was great seeing you take part in the scavenger hunt and really engaging with Eric's presentation. We're going to have more information posted to our website, worcesterhealth.org. I do want to also plug, we're going to have a evaluation of the conference. Jackie Ward just did post that into our chat. I want to thank all of our partners from every agency in Worcester, from public health, law enforcement, education, government, all the municipalities. And then if you're if you're interested in being more involved in local public health efforts, please consider joining the Worcester County Local Health Improvement Coalition, the LHIC. So you can be part of making the community a healthier place to live, work, and play. Jackie Ward, again, has a link for a form that you can fill out, or you can contact her at jackie.ward@maryland.gov. We will have presentations from today and additional information on the topics that we covered on worcesterhealth.org later this week, as well as our social media. And Summer, I'm going to go ahead and turn it over to you to add anything to the closing or to tell at least a minimum of 2 knock-knock jokes. So all yours.
You said everything I was going to say, other than eat healthy, be active, and prevent all the chronic diseases today. Thank you all for attending. Have a wonderful rest of your day.
Thank you all. We're going to end the meeting now. The full meeting too has been recorded, and we'll be posting that to our website, social media, Facebook, YouTube, all of that. So thank you all. Have a great afternoon. Bye.